This is the Caelestinus 2023 final demo. You are here to witness a number of pitches, 13 pitches of the teams in our incubation that made it through a very demanding, tough 8 months program that was happening mostly online as well as offline. And it's my pleasure now to present you at the final demo day the 13 teams, startups that made it and are ready for your investment. So my name is Tomáš Studeník. I am the Caelestinus number 1. We also have Caelestinus number 2, and I will invite a number of guests to join me on stage to talk about why our second year is even more successful than the first pilot last year, where we didn't know what we were doing, but now we realized we must do much more. So what's ahead of us? First, the partners that are behind Caelestinus. So InterSystems is our main partner, founding father. So thanks InterSystems for your continuous support. And I am really excited to show how your technology and your mentorship and expertise powers successful future healthcare startups. It's also my duty and pleasure to thank the Institute of Clinical and Experimental Research, where I'm standing right now, and some of you have joined us here in the audience, for their support of letting our teams train on data, consult with mentors, providing access to patients. And this is for any startup that wants to do new solutions in healthcare, in hospitals. It's absolutely crucial to pilot with hospitals. And we are so thankful to IKEM that we have been able to cooperate for second consecutive year. And big thank you to the Faculty of Biomedical Engineering here in Prague for being our main academic link and helping us to recruit new students and consult our progress through academic lens. This is a quick recap. Originally, 60 startups applied to join Caelestinus in February this year, and 21 got the invite to join Caelestinus, and 13 made it to this day, to the final demo. So as you can see, it's pretty competitive to enter, and it's pretty tough to accomplish the full 8 months of incubation. During those months, you test your team, you test your initial idea, you need to pilot all sorts of buzzwords, but maybe you realize that your original idea, there is no market after all. But 13 projects, they found market fit, they realized there is a potential to build new products and services globally, and we were so happy that some of those teams made it to the US, presented, and already are talking to the biggest market players in the US or elsewhere in the world. This is just a few achievements that Caelestini have shown during the incubation period. Most of them are running pilots in hospitals. Some of them dazzled Global Summit in Miami in June. Both teams that won the most likely to use and the most innovative award were Caelestini, and also a number of Caelestini dazzled audiences in Las Vegas at the health conference and summit this autumn. And one of those also got started talking to Mayo Clinic about further achievements, and a number of startups are finalizing the investment deals as we speak. But there should be more after the demo. What's ahead of you is it's a very demanding afternoon on your part, the audience, because there will be 13 sessions. There are 13 minutes each. I recommend you, for those that will pitch, just try to keep it under 6 minutes, your pitch, so that there is plenty of time for questions from our audience, who are mostly investors, startuppers, and medical professionals, hospital owners, etc. So please allow enough time for questions. Of course, if you are watching this and you have a question, you can use the Slido channel, or you can ask directly here in IKEM if you happen to be in Prague. If you want to get in touch with the teams later on, maybe you have realized, that could be interesting, or you'll be watching a recording, then just reach out via our Caelestinus.tech website, and we will happily put you through. This is the menu for the afternoon. So I have a really brief introduction. I'll invite a couple of keynote speakers very shortly before we start with the pitches. There'll be a break in the middle, half an hour break where you can talk to the startups. There'll be an opportunity outside of the conference room here at IKEM for you to see the demos, to play with the solutions, and then we have the final portion of pitches, and we should be finished by 6 p.m. Central European time. So that's your agenda, and of course, all of you are invited to join us for an after party. This will be offline only, unfortunately, so that's one more reason for you to come to Prague. And at 8 we'll be starting at the swim club in Štěpánská Street. Everybody's invited, and we should be there at least until midnight, but who knows. So another opportunity to meet teams in person and maybe make investment offer after they are well into the night. First keynote speaker is Dean Andrews, and it's my pleasure to invite Dean to say hello. I think Dean will be joining us online. So Dean, hello.
Can you hear me?
Yeah, we can hear
Excellent.
you. Excellent.
Thank you so much. Thank you, the whole Caelestinus team, IKEM, and all the partners. It has been an incredible year. To the startups, I want to say that we have been inspired to watch your journey over the past several months. I've had the great fortune of meeting many of you in person at events like Global Summit and Health in Las Vegas, and even in our office here in Boston. And it's been wonderful to hear your stories, to see your work up close. We are proud to have been a partner in Caelestinus and a partner with you in your journeys so far. We are very excited to see your demos today and hear about your progress. We hope that you have found InterSystems to be a good partner thus far, and that you will continue to do so. And finally, I only urge you all to keep going. Keep working on your startups and your solutions. The work you're doing is incredibly important. It is improving people's lives. Thank you all so much. Thank you.
Okay, thank you, Dean. So it's always a pleasure to have Dean, and your speeches are so well prepared. I mean, amazing, Dean. Thank you for your continued support. I hope to meet you soon in person somewhere around the world. And our next keynote is none other than Petr Raška, CIO of IKEM, who will join me here on stage in Prague. So,
hi, Thomas.
Hello, Peter.
So, welcome here. I'm here on behalf of the IKEM management, and I've prepared a short keynote. It's a story about one innovation that happened here in IKEM. Maybe you don't know, and I will ask for the slides. It's the story is connected with how IKEM was established. So basically, IKEM was established in 1951, and it consisted from like 6 different organizations within Academy of Science, which then later on were joined into IKEM, as you know today, in 1971. It was back then. It was like Iron Curtain, communism was all around. So even because of these obstacles, we have been trying to innovate, not only on the Czech level, but also on international level. I will show you some images from that date.
Let. Tento pacient už míří na koronární jednotku. Ta první vznikla v roce 1966 v Praze.
Vznikla zde před léty jako jedna z prvních na světě a první v Československu.
Nikoliv příčina, ta známá nebyla, to se časem změnilo a s tím i léčba.
So basically, even in the 60s, we have been something like pioneer in the medical science. So I was thinking that we will probably show you that this is also why the IKEM is supporting Caelestinus, because it's written in our DNA. So not only that we've established the first coronary unit in the 60s, but there were a research group in IKEM, which was like a research group that was focused on circulatory science, which part of this group were the guy you probably know. It was in Czech. His name was Wilhelm Ganz. But these people they emigrated before the 1968, before the Russians came into Czech, which happened now that they are now invading Ukraine. But this guy, Wilhelm Ganz, started inventing here what was like a foundation for Swan-Ganz catheter. So he emigrated together with his fellow colleagues, and in the United States he met his mentor, Professor Swan, and they finished let's say, inventing this, let's say, breakthrough invention, basically the pulmonary artery catheter. But the basics of this were invented in 1960s here, and now one of the makers, it's Edwards Life Sciences, and I've asked them, and they send me a footage where Mr. Ganz and Mr. Swan are describing how they invented. So I will play you a short video.
One evening I had to look after a very, very sick woman, and I had ultimately to abandon attempts to catheterize her. The next day I was on the beach in Santa Monica, and I noticed a spinnaker.
Dr. Swan came up with the idea that maybe we can make the catheter float by attaching a sail. That made some people laugh, but it was their last laugh.
The idea that there should be a flotation device, something to take the catheter through the right heart, was the basis then of the flotation catheter as we know it.
We realized that we cannot rely on simply clinical symptoms. It was guesswork because people did not have no way of seeing what is happening inside the body. People thanked us. They said this is indeed a breakthrough and will help us to take care of patients whom we could not before examine properly, and a major opening of doors for critically ill patients.
For the first time in anesthesia, people could measure the pressures in the right atrium, the right ventricle, the pulmonary artery, and the wedge position. And that they could identify the effects of different drugs and different procedures.
The numbers became indicators of what kind of method we have to apply to help improve the patient's condition.
It very rapidly became accepted by the anesthesiologists because they could now put these devices in patients and they could then use the information to guide them in the management of patients undergoing surgical procedure.
So basically, this is about that. Despite the events that were mostly political, you can invent or you can start building successful innovations and then successfully go to market. So I think even if you are, let's say, facing some struggles in your own projects, this is, I think, a really good example that even in the 60s and 70s, there was not enough resources, not enough materials. It is possible to make a breakthrough in invention, and this is an example like how we are doing it here in IKEM. So this is it, and I think I wish you good luck in your pitches.
Thank you, Peter, for your support. Let's hope that Caelestinus will be also like the mycelium from which these inventive mushrooms will mushroom. And the last keynote, we have, I think, about -2 minutes to do this. So, you know, that's the usual mixture for innovation, which is like tight deadline, limited resources, and stress. So, Yevgeny Shvarov, it's my pleasure, Yevgeny, to welcome you, on stage again.
Thank you, Tomasz.
And Yevgeny is the like co-founder or the other father of Caelestinus, because the idea for Caelestinus, maybe you want to say how it happened here at IKEM.
Hi everyone. Yes, a few words how Caelestinus was born. Exactly, the idea. It's like this magic when idea comes to reality, and this and IKEM is, as we know now, is it's of course it's the place where healthcare is going on, and also it's the place where innovation turns into reality. And we were sponsoring a few years ago European Health Hackathon, and it was such a pleasure, of course, the hackathon that Tomasz ran together with the IKEM, and we just thought, oh, why it's only 2 days? Yes, and the solutions hackers did in 48 hours, they were so amazing. They addressed the real problems that IKEM set up, and IKEM and Edwards Lifesciences, AstraZeneca. So, and we thought, can we do something with that, right? Can we like prolong European Health Hackathon for some longer time. Yes, and this is how the idea of Caelestinus was born. And today we are inviting residents of the second Caelestinus batch to show their innovation, present their innovation in today's demo day. And actually, yes, it was 8 months, and it's such a pleasure to know you. We almost became a family. So I think we, as we know, like as with our previous experience with for the first batch, we continue collaborating. And we also, I think we will continue with you, collaborate with you too. But also, yes, it was 8 months, but actually sounds a long period of time, but no, so the time went very fast. And I want to say thank you to all you for your hard work through this Caelestinus incubation. Also, I want to thank Caelestinus team, Tomasz, of course, Piotr Żabka, Vita Tsareva, Irina Baskova, and dozens of outstanding mentors that did several, about 40 workshops. Vita could correct me. So it was a lot of experience. It was a lot of insights, and I hope. And of course, it was a lot of collaboration that startups started working together to interchange the experience and the innovation. Yeah, this is all very exciting, and the good phrase, good luck. So as all entrepreneurs say, yes, sometimes we also, besides innovation and hard work, sometimes we just need luck. So I wish you luck, and thank you, and actually let's please show us again your innovation, what you did this year. Yeah,
Okay.
Thank you.
Thank you, Evgeny. So we will jump straight to the pitches. I think we'll have our first team, AfyaRekod, joining us online. So let's see if we do manage to get the connection.
Hello, can you hear me?
Yes. Hello. So the stage is yours. I recommend to keep the pitch 6 minutes maximum, so that there is plenty of time for questions. Okay. Thank you. Go ahead.
Excellent. Thank you, everyone. Appreciate the opportunity. Good to see some of the friendly faces that I've seen throughout the year. And I'll go ahead and begin. I'm going to share my screen, so give me one moment. Can you all see my screen?
Yep.
All right, excellent. Well, thank you, everyone, again, and I appreciate the opportunity to pitch. I'll be very quick so we can leave time for it. In 2019, literally tried 4 main things. They included management, storage, access, and mobility of health records, especially here on the African continent. It's a bit of a challenge, as many hospitals are not connected. We perhaps sometimes take that connectivity for granted, and we look at people like InterSystems as great models for us, who have actually built a pipeline by which health data can move freely for the benefit of the patient and the provider. So as such, we have, us at AfyaRekod came up with a way to do this for people on the African continent. And I'll move through some of the background quite quickly and focus more on the products. But this is just a bit about 65 facilities with another 200 in our pipeline. Over 300,000 patients are within our network, and about 30,000 are used.
We cannot get the audio clearly.
All right, sorry, I think I had an issue with my connection. I'm going to move quickly.
Yes.
So as I was saying, we're in about 65 fully operational 65 health facilities with another 200 in our pipeline in 3 different countries in Africa and looking to expand into 3 more in the beginning of next year. As I said, yes, we focus on patient-centric health management with 3 different angles: our B2C products, which is our mobile application and our web app for patients, our B2B products, which go out to organizations and hospitals. And we also have a B2G product where we provide governments, public entities with health analytics about their populations, and they're able to use that for all kinds of decision making. Just a bit about us, our vision and our mission. I guess the first one will have to deal with some challenges, so maybe I'm the guinea pig for this one. But again, this is just some of our traction to date, where you can see this here. A snapshot of our technology includes the MAIA platform. This is now the patient portal. This is where patients can actually access and engage with their health records, store, manage, and mobilize their health records. They own their health records. It belongs to them in Africa and in Kenya here, where we're headquartered in Nairobi. Ownership of health records belongs to the patient. So it's really important for people to be able to get access to their health records, be able to mobilize them, be able to engage with health providers. As you can see, this is available in 3 different formats: the web app, the mobile application, and because many people of low-income areas and rural areas don't have access to smartphones, we actually have a USSD functionality for non-smartphones. And because this has to be something that everyone can engage with, it was important for us to have that as part of our offering. These are just some of the features that belong to the MAIA platform. Your health diary, your health folders, and a few other features that allow you to engage with your health information. This is also open to organizations, very much the way Uber has a different app for riders as they do for drivers. This one for organizations is now what small-scale organizations would use to manage maybe small practices, small clinics that may not require a full EHR system. Next is AfyaCare. AfyaCare is our flagship product. It is the EHR system that we have deployed in all the different facilities we have. These are the various modules in the AfyaCare system, and there are very many more that we are releasing. In fact, just last week, we released our Operation Theater module, which we are now launching with the Nairobi Breast Center, which is a breast cancer treatment center, and they will be the first clients using it. So we're very excited about that. But that, along with many other different of our modules, these are, by the way, individual modules that can be kind of packaged separately for people with existing systems, not to have to take a full system. We can actually just provide them with an individual module if they need, because our whole mission is about connectivity and not really about pushing other EHRs off the market. We are more interested in providing that link of health data across platforms for patients and providers. And again, we take very much an inspiration from InterSystems and what they have been able to do, not only in the US, but all over the world. We would like for that to continue in Africa. We also have a community health worker tool. In Africa specifically, community health is very important. It's the level 1, it's the lowest level of health that people engage with, especially people from rural and low income areas. So for that, we created a system that allows community health workers to actually be able to go into these areas, register patients, track them, and actually refer them for services in the various health facilities that are on board. So it's a very good idea, good plan, and the patient also receives an account, and everything has been digitized. So whether you have that non-smartphone or you have a full, computer or smartphone, you'll be able to receive your alerts, you'll be able to receive your referrals, you'll be able to know when your appointments are, and the basic level of engagement for those people in low income areas and rural areas also get the ability to interact with their healthcare. And the community health worker who goes from door to door to check on them is also digitized. These are just some of the modules in the health worker tool. We also have a marketplace where people can come and look for services and providers. Some other elements of the marketplace. obviously including telemedicine functionality. And a new plan, which we're excited to be entering into next year, is our telemedicine stations, where people can actually go to brick and mortar telemedicine stations, engage with a lab and a technician or a nurse on the ground, but be speaking with a doctor and a specialist far, far away. This really helps people who have to travel very far to see a specialist. In Africa, the specialists are always in the city areas, and people have to actually spend a lot of money and a lot of resources to travel just to see a specialist. So you get the care from the nurses and the lab technicians on the ground who can do the the basic work, while also being able to engage with a specialist from the city area. The health data cloud, we're very happy to be talking about this.
We will have to finish the pitch. We have run out of time. So is there like a very last slide?
Yeah, I mean, the most important part, I think, that differentiates us between us and other providers is our focus on interoperability. So I just want to mention that. And just some of the data compliance regulations that we follow, obviously, that's very important. Obviously, some of our partners, just a few to name them, and we're very excited and happy for them, as you can see here. Snapshot of our team and our contact information. So apologies for the technical difficulties. I appreciate the time, and I look forward to being able to answer any questions you may have.
Okay, thank you, Eric. If there are questions, we will route them directly through to AfyaRekod. So there'll be no questions right now because we are really run out of time. But if there are questions, we will pass them on, Eric, to you directly. So thanks for being the opening pitch at the demo. We'll move on to our next startup, which is Health Circuit with Surgifit project. And it's my pleasure to welcome Jordi here on stage at IKEM. And whenever you are ready, you can hit it off.
Can I have the pointer,
yes,
please? Thank you, Thomas. I'm very happy to be here, and I want to thank the people at Caelestinus and InterSystems and IKEM for this opportunity. So today I'm presenting Surgifit, which is a tool for automating the procedures of surgical pre-habilitation. We are Health Circuit, an official spin-off of Hospital Clinic of Barcelona. And the problem we are trying to solve is to lessen the burden of the impact of surgery, because we are talking about one of the most complex parts of all the process of survivability of any patients in the world. Here is where surgical rehabilitation enters. Very briefly, without surgical rehabilitation, the standard care, we know very well that this impact exists. And surgical rehabilitation is a way to mitigate this impact because it really improves the outcomes on surgery. This is an intervention that can be performed before surgery, and what we do is presenting our platform, which is Surgifit, which allows this automation, because in the hospital we have done research for 10 years in this area. We have a department that is working in the practice day to day with patients for more than 6 years, and these practices have been curated, they have evaluated, and the research and evidence has been published and peer-reviewed. So with this, and what we are doing is converting the research of the hospital into this kind of products from a hospital, from doctors, for other hospitals, for other doctors, to improve the practice of medicine. In this particular case, what we do is a multimodal intervention. Essentially, we coordinate anesthesiologists, physiotherapists, nutritionists, and psychologists during these 4 to 6 weeks through our care plan. And we coordinate what is done on the side of the clinicians with the patient through a mobile application, and our interoperability is done through InterSystems. And there is a reason for this, and I will speak a bit about it later. But first, the evidence. We have published evidence that states that by doing surgical rehabilitation the way we have been doing it in our hospital, we get half complications during the surgery itself, we get twice as fast recovery during intensive care, and a 6-fold reduction in the 30-day readmission, which is a good reason to run rehabilitation programs in any hospital in the world. And this is the reason why OCDE last May recognized us with a report stating that the practice we are conducting is the best practice in OCDE countries. So we will be publishing this openly this month of December. We will be running some webinars to explain what we do and how our tools can help your hospitals to get this very quickly with best practices. So for surgical rehabilitation teams, what do they get? They get these panels where we have modeled the best practices and where we have different sections for inquiring on the treatment. Inside it, what we are using is what we call adaptive case management, which essentially gives control to the doctor, but still it guides him through these best practices so he can choose different activities for different profiles of patient to adapt and personalize the care for every one of them. On the side of the patients, what we get is a full coordination with all your physicians. So you have a chat that allows you to directly interact with them. You also get notifications from them, and this is done on purpose. We are cloning the most popular messaging applications because, especially in elder people, there is a fear for adopting this kind of tools. But after the pandemics, this resistance has lowered, especially on the side of messaging applications. You also get a very nice dashboard where you can see what you have done from the treatment today, what you have to do, and what you have not done, and then we can keep a very good track through our case manager of the adherence of the program. What differentiates us is that we have done this in a format that is a little bit different than usual. If we had run this in the traditional way, probably we would be taking these processes and implement them through some kind of business process management system in some kind of hospital management system. That is a very expensive, very slow procedure to do. So instead of that, what we have decided to do is create a B2B platform using a classical software as a service model, which is not very often encountered here in healthcare. We can do this thanks to InterSystems, because thanks to them, we can isolate all that we do in the cloud and interact through the Share Connect and Iris with what is inside the hospital and keep a clean split of all the data. Thanks to this, we are already running in pilots. So what you see here is not theoretical, it's already working with real patients in pilots. So Hospital Clinic got into production last August. We are already also in University Hospital of Mannheim, where we are already working as well. We are in talks with IKEM to run a pilot here, so we hope it will be happening soon. And we are also in talks with other people. By the way, I'm not the CEO of the company. Our CEO is not here today because he's actually getting those pilots for us in Australia right now, right today. He was last week in Singapore. We were with InterSystems not long ago in Las Vegas. So we pretend to be the tool for surgical rehabilitation in the world, not just one more mobile application. And this is what differentiates us from the competition. Some people are doing applications that are more focused on showing some tips on the mobile phone. What we are trying to do is make a comprehensive tool that will help both clinicians and patients and bring them together so that the things can go very quickly. And this intervention that nowadays is essentially in pilot mode in many hospitals, or not so many, can go forward very quickly with this kind of model, because this we have seen in other industries that works, and we want to bring it here. The founding team is very experienced. Our CEO, Isaac, as I said, he's not with us today, but he's watching, so hello, Isaac. Dr. Josep Roca is a very reputed clinical doctor in Hospital Clinic, and Dr. Serrano Pons, our COO, is present here today, and he has a huge amount of experience in everything related to digital products for medicine. So, funding traction, where do we stand nowadays? We have had until now more than 350,000 euros of investment, both from public and private sources. We are an official spin-off of the hospital, so the hospital has a share in our company, and this means that everything we do goes through the clinician team. So everything we do is validated by the doctors that will be using it on a daily basis. And this is very important for us because this is what we say we do from doctors for doctors. And then we are now focusing in these pilots because our objective right now is to go for all the branding, so CE certification, for FDA certification, because we want to start in Europe and in the United States, and then go as fast as we can everywhere in the world. Until we get the certifications, we are running pilots in collaboration with research teams all around the world. And this is very useful for us because this allows us to go to the research teams that are already doing pre-habilitation in the world and bring their processes into the platform. Thank you very much, and if you have questions, we will be happy to answer all of them.
Thank you, Jordi. You can ask questions via Slido, which I'll then translate, pass on, or you can ask them directly if you are here at IKEM. So we'll pass a mic for you around. So go ahead. Do we have a mic? No. Okay, I'll repeat. Can you tell us a bit more about the payment scheme?
Yes. As we are doing this B2B, so as a service, what we can achieve is an integration using ShareConnect and Iris, which is optional, but it's very interesting because it opens new use cases. So this is usually done by the InterSystems integrator in your hospital. That's why collaborating with InterSystems is so good, because it's the core of Epic. That's 85% of the market quota in the United States. So it's a big improvement for everything related to interoperations. And then €100, sterling, pounds per patient and treatment, flat rate.
Do you expect your service to be covered by insurance or not?
When we based this business model, we were based on the NHS from the UK, because they were saying, don't bring us any kind of innovation, bring us innovation that actually reduces the costs of the system. And one of the things that we have published in our evidence is that in hospital clinic with manual processes, with a big team, we actually do that already. So now with the automation, we expect this reduction to be even bigger. So what happens here? The reduction we get manually in Spain, which is important, is around €850 per surgery. And we are talking about only 30 patients managed by 25 physicians and professionals. So there are not many economies of scale. Now just think about it. I can reduce the cost of the surgeries in a whole hospital or in a whole healthcare system. That's why we go with this B2B, because we want to go fast. So who will be paying? Our hypothesis is that national healthcare systems will want to do this because it reduces the budget, and this is what UK was mandating for innovation. But also insurance companies will be certainly interested in doing this, and that is also one of our targets. We're already in talks with some of them.
Okay. More questions?
One last thing regarding monetization. Since we are doctors essentially from a hospital, and we are in theory not so good at selling, in theory, what we are also doing is white labeling, so we can go even faster. If we find a good partner in a region where we have not an established presence, we can white label the product so that it can become your product. So if you have good relationships with the people who are decision makers and you want to include rehabilitation in your country, let's talk.
Okay, still...
Actually, we are already talking about that in Poland. So,
good for you.
This is not just an hypothesis anymore.
So one last question. You can use Slido if you are watching us from afar. Right. So it looks. That's it. Thank you, Jordi,
for your time
your pitch
and the chance.
And thank you. And it's my pleasure to invite our following Celestini to present here on stage. So guys, are you ready?
Yeah.
Perfect. So we are now moving to the GluMCo team. And come on, we have Martin and Dusan who will be presenting.
Hi, Thomas.
Hi, it's nice to see you again.
Yeah.
The winners of the last hackathon that a few days ago just happened here. Congratulations again, and I'll give you the tools of trade, and the stage is yours, guys. You have 13 minutes.
Okay, thank you. Hello, everybody. Good evening. We are Martin and Dusan from HT Hackers, and we are developers of GluMCo system. So, did you know that a nurse has to visit each patient an average of 2 times per hour to check the patient about his condition and make necessary examination. So we want to help them, and that's why we would like to introduce you to GluMCo system. By the way, GluMCo stands for Glucose Matters Data Collector. So Dusan, can you tell us how the GluMCo works?
Yes, I will try. So firstly, there is a sensor for continuous glucose measurement, which is given to the patient during the check-in in a hospital. Or there is other possibility that patient has his own, and in that case there is no additional sensor needed, and we can read that too. Then we connect our GluMCo receivers in several places in hospital department, and to collect all data from all sensors in several intervals. With our solution, patient can then move freely around the hospital department without any wires or other devices. Finally, we processed all collected values and send them directly to the hospital's information system. What is the origin of our project? It is a solution from the last hackathon, the European Healthcare Hackathon 2022, and where we developed our first prototype, which was called Diap. And then we have been working the whole year with the help of the Caelestinus incubator to bring it out into the ready-to-use application called GluMCo. So now let's have a look at the innovations and benefits of our system. First, it is automation. Thanks to our device, the entire glucose monitoring is automated, and all data are sent directly to the patient's record, where are available for the medical staff. Also, it is possible to measure real-time data during the surgeries or in ICU units, where measurement with normal methods is not possible. Second, it is elimination of human error. With automated process, there is no possibility to lose some samples or make a mistake during the measurement or value assignment. And last but not least, it's the reduced amount of the waste in a hospital. Because from now on, there is no need to take blood for the test from the patient. So it means that it's not needed to use gloves or disinfection needles and other material. Also, it means less pain for the patient.
Okay, and what we have? We already have complete final electronic boards in production. We have 3D printed boxes for assembly and mount to the wall in the hospital. We also have the complete software, every systems and API server for transferring data from our system to hospital information system. And this day we are launching the pilot here in IKEM on Department of Diabetology. So, however, the development is still going, and we have several tasks to solve. The first one is a new version of sensor. The Dexcom company, which sensor we used, released new version of the sensors, new generation, and we would like prepare our system for this new version of Dexcom sensor. Also, we would like prepare our system for other sensors in the market. I know about 3 and 4 other company who has the sensors. So that's the big task for us. And finally, we plan integrate our system to FHIR platform developed by InterSystems. So that was everything technically, but what we like to do in the business side. So first one, we have to evaluate the pilot and finish the final product. With this product, we would like reach other Czech hospital and expand our user base. And finally, we would like find a partner for preparing our system and our company for the expansion to other countries in Europe and USA also in the future. So currently we work at well-tuned teams of 3 peoples, and we are cover every discipline in our business, but we are not afraid about other connections, contacts, and whatever. So thank you for your attention. We are HT Hackers, and that was GluMCo, and we will be happy to answer your question here and in the coffee break at the FHIR. So thank you and have a nice day. Tomáš? Any question? I'm not sure if I understand your question.
Okay, the system which works now mainly with the Dexcom sensor. Yeah, Dexcom has API for data, but this API does not give the real-time data, and also it's needed to be connected with a mobile phone, which is not very useful. For example, in a hospital, where in one department you have maybe 20 patients, so it means that you need 20 phones, and this is the improvement of our solution.
But if any patient have a sensor for the standard measurement, we can use this for our measurement. It's compatible with Dexcom application and our system. We hack the system.
Okay, more questions? Okay, let's go.
Just now only for Dexcom, but we would like prepare our system for other sensors. It's a long way for this.
It's because Dexcom sensors are used here in IKEM, so it was the first proof of concept.
Okay, guys, I think the question on Slido is how do you interact with health information systems? So maybe I don't know if it was answered, but this is now designed for based on which information system, or what's your future plan to build the APIs or whatever?
Currently, we have own API server for data connection, and we plan integrate FHIR and other InterSystems systems for the communication, because FHIR and InterSystems are standards in Europe and USA, so I think it's our plan for the future is integrated InterSystem.
Also, the solution now is developed in a way that we have, for example, now our own REST API, but it's not hard to make tailored just for each hospital different API. For example, if they want GraphQL or RabbitMQ or something like that, it's all possible to create.
Right, so we still have time for one more question. check Slido. So I think that's it, guys. Thanks for your pitch.
Thanks for the opportunity.
I'm excited to see your sensors, making it to the rest of the world from IKEM here. Thank you, guys.
Yeah, thank you.
Thank you.
Good luck. To give you some idea about what was happening in Caelestinus. Some of you know, some of you don't. So it's a mix of, it's an incubation program that offers you a mastermind session, expert mentorship on certification, on regulations in the US as well as European Union. And what was exciting was the trips to the US for mostly non-US teams to the InterSystems Global Summit in Miami, where we were amazed that among 35 startups and new projects, both the projects that got audience votes and awards for most likely to use and most innovative came from our incubation program. And then our teams also, together with InterSystems, could present at either HIMSS or Health in Las Vegas, and this is something that's part of the beauty, the offering of Caelestinus, that we take the teams that have something to show and help them shine at the largest global healthcare events. Okay, so about piloting, of course, a lot of teams, when they join Caelestinus, they are desperate for healthcare data, access to patients, access to physicians in hospitals, and that's something that we also helped to bring about. And a big thank you goes to IKEM here for supporting our teams with pilots. And actually some of the prototypes are being used right now here, not far from where we are sitting and talking, and being tested, validated by users, by not just physicians, but also medical staff, nurses, etc. So I think this is something that Caelestinus wants to keep also in the next year, and that's access to hospital pilots. In the Czech Republic, we have been cooperating with IKEM, also with the Faculty Hospital of Hradec Králové and the Rehabilitation Center in Kladruby. We are expanding the hospitals internationally, and we'll have some news for you at the beginning of next year, where additional pilots will be happening for Caelestini. We will go to our next team, which is Rarus Health, and on behalf of Rarus Health, we should have Elmira on the line. Yes, hi Elmira. I can see you, and I think it looks like we can see your screen as well, which is a good sign. So
super.
Excellent. So the stage is yours, Elmira. So it's Elmira from Rarus Health.
Perfect, guys. Big greetings from Chile. So let me introduce Anna. When her son have problems, and when he was 2 months old, Anne noticed that he had difficulties holding his head up. But all specialists told her that everything was okay. And only 3 years later, they recognized that it was first signs of a spinal muscular atrophy, one of the rare genetic diseases. It's Josefa. Josefa is a pediatrician. Let me show Josefa, and here is it. So Josefa, she's pediatrician, and actually she admits that she has big problems in diagnostic of rare diseases. She even doesn't know how to manage such patients because she needs a special team for that. This is me. Elmira Safarova, just 20 years ago. So at that time, I was working for a pharmaceutical company and spent a lot of time searching for data to design studies. Because if you don't understand disease, you won't be able to develop a new drug to treat this. Now I'm founder and CEO of Rarus Health, startup based in Chile and startup that solves all these problems. Problems of 350 million patients with rare diseases, problems of specialists who need more knowledge about genetic diseases and who need a team to manage patients with such diseases, and problems of pharma industry, which is hunting for patients and data, everybody wasting time and money. So Rarus Health developed platform that brings all pieces together and generate data that improves care and accelerate research and marketing of new drugs. Our platform is already helping patients and specialists, and you can see them using this QR code. Our digital assistant for family helps them go through diagnostics to treatment. We help family to collect and store medical and family histories. We give them personal case manager and prepare them to the doctor's appointment. This makes life of family much easier and improve quality of life. Professionals can work as a team using information from patients, and this reduces time per case and increase the efficiency of disease management. With this two-side source of information, we use it to convert it into deep real-world data sets. We are working in the cross of 3 different growing markets, which are driven by industry, customers, and regulator. We see our advantage in a patient-oriented approach and two-side cooperation with both patients and specialists. But we like the destiny of our competitors because most of them have been acquired. It provides clear understanding for our investor what kind of exit strategy we may have. We gain main revenue from pharma industry, but we start to work with patients because it gives us big opportunity to involve them in co-development of our solutions. Additionally, premium model give us financial sustainability. Our startup was born based on our experience. Mine from pharmaceutical industry and startups, experience of Raul and his team of 3 in development of medical software, and dual experience of Fernanda, who is a patient with rare genetic diseases and also a medical specialist. But actually, our team is even bigger because we have a great network of our ambassadors and partners from around the world. As part of Caelestinus, we are gaining knowledge about data interoperability because it's really cornerstone in rare genetic diseases where all information is fragmented. Iris for Health give us ability to collect this information and share data without any borders. We have a waiting list of hundreds of patients right now, from all over Latin America, and we are converting these patients into our users right now. We are also working with Duchenne muscular dystrophy community to develop first in Chile, decentralized patient-focused registry, which will be based on our platform and HL7 principles. Right now, we are raising our first pre-seed round of $600,000, and we already pitched to investors from Chile, Mexico, Argentina, Brazil, and the United States. And we are going to use this money to start to work with artificial intelligence to curate collected medical information, to improve our ability in case management of families, and also to build interface for pharmaceutical industry. We believe that helping families today will speed up drug development in the future.
So thanks, Elmira, for your pitch. Now your opportunity to ask questions, either here at IKEM. I will repeat the questions so that you can hear them, or via Slido. And there is one question on Slido. What is the current traction status with Rarus? If you could expand on your traction.
Great question. So with regard to traction, right now we are working with database of more than 150 patients across the world. It's from Europe, from United States, and we are collecting patients right now in Chile, in Colombia, in Argentina, and also in Mexico. And actually, we right now co-develop our solution with them, because you may know that Latin America is a really interesting culture, and we are adapting our platform to this culture right now. And this is why we decided to work together with Patient Society of Duchenne muscular dystrophy, because it's really go-to-market strategy for us, where Patient Society help us to organize network and to improve our relationship and trust, which is very important, with both communities, healthcare professionals and patients.
Okay, thank you. There is one, two. Was there a question also? No. Okay, so let's start here from Jordi.
Congratulations, Elvira. So in rare disease, there are many different types of rare disease. So are you concentrating in some specific one? I foresee, for example, glucogenosis. There are many myocardial disease, core disease. This type of rare disease do require special features, for example, collecting data every 3 hours of glycemia. And so when you are targeting the real-world data platform, you are focusing in some specific diseases that pharma could really work on them easily, or what are you trying to do first as a strategy? Just to understand.
Jordi, many thanks, great questions. Exactly. Actually, there are 7,000 rare diseases which we know right now. And we are focusing on diseases which have some kind of neurodevelopmental delay. So this is neurology, and neurology is second after rare oncology market segment of rare diseases. And we are focusing on this segment because usually parents and caregivers of kids, I'm talking about kids because 50% of patients with rare diseases, unfortunately, kids, but we're also working with adults. But these parents and caregivers can mention first signs of rare diseases before healthcare professionals will be able to do this. Do you remember Anne from my first slide, who mentioned some not good with her son firstly? So this is very, very not normal, but standard way where we see in neurological diseases. So we are focusing here, and actually also it have a business reason, because a portfolio of pharmaceutical companies is bigger in this area.
Okay, before we have one more question from the audience, I'll go for one on Slido, which is, what is your company path for investment?
Can you repeat, please? I didn't hear.
What is your company path for investment? Meaning probably what's your now strategy for investors?
Great.
What's your ask? What are you looking for in terms of investment?
I'm asking about $600,000 of proceed using SAFE and YC template of SAFE. It's clear cap table, and we raising this proceed in Latin America, but also I'm pitching in United States because we haven't plans to go to this market because maybe you know that 20% of population in United States Hispanic people. And we know how to enter this market with Hispanic population, and it will be our fair competitive advantage on this market.
Okay.
So right now, proceed 600,000. Please email me. I will be happy to discuss this in more details.
Okay, thank you. Question from Honza.
Hi, so could you please tell me more about your selling points and kind of value add for big pharma, because I'm always interested in that. How do you look at your customers and your value add for them?
So our value proposition for pharmaceutical industry consists on two parts. First part dedicated to marketing team, because when pharma is planning to enter some markets, they need some information, some data to understand patient journey, number of patients, what is interaction between healthcare system and these patients, and to prepare based on this data their strategy about marketing, launching, and et cetera, et cetera. So this first part of information which we collect in patient journey. And our competitive advantage here is that we collect not only patient, but also specialist journey. So because we see in engagement between patients and healthcare specialists. Second part, data which we can provide to pharma. This is some insights about real clinical practice and natural history of disease. And here I'm talking about R&D department inside pharma, because to plan a protocol for clinical trials, you need two things. First of all, outreach patients. And in this market, cost of patients outreach around $35,000. And second part, you need to plan how you put your protocol, what would be efficacy, what would be important for patients and for disease. And majority of rare genetic diseases don't have any data about real clinical practice, about natural history behind it. So this is another value proposition, which is for another department inside pharma.
Okay, thank you, Elmira. That was your last question, and thanks for tuning in from Chile, and fingers crossed. Thank you. So after Elmira, we have Alex. Alex from iPlena, who should be joining us online. So let's see if, yeah, I can see you, Alex. Nice to see you again.
Hi, how is your shoulder?
Shoulder, actually, it's gone, the pain. It's amazing, because Alex, he showed me in Miami a few exercises for my shoulder, which I tried a couple of days or maybe a week. I exercised and it's gone. Amazing. So Alex, now I'm excited. I can't wait for your pitch magic also to help the investors' dollars disappear. Alex, so Alex iPlena.
Thank you very much for the introduction. So first of all, I'm happy to be here. I'm also really happy to be part of the Caelestinus Incubator program, and the process. Yeah, it was really long but good, and I had a lot of learnings that I also want to introduce during my pitch. First, a bit to me. So I am Alexander from Germany. I have 3 clinics here, and iPlena is one of my projects that started from my childhood. We call it like this because I had scoliosis by myself, and I looked for several ways to solve it. And the way I entirely solve it was a bit not good for kids. So I came to a scoliosis boot camp, what it was like a military camp for kids, and had like 4 hours exercise a day, and yeah, sleeping without pillow. So it was not nice, and far away from home, and not really happy there. I had some ideas how to solve this problem better. So I started to learn physiotherapy and osteopathy, and then I came to building this data to generate this AI solution. So today I want to introduce to you iPlena, and for now we are named in the App Store PhysioScan. So what we are an AI-based 360 degrees posture assistant. Why 660 degrees? Because we are not just measuring the posture from the front, we are measuring the posture from all sides. And this is something that makes us special, and where we make also the relation to the posture evaluation. So so the bad news we have is that the traditional treatment of pain is not effective. And this is not new for most of you in the auditory, because everybody knows it, that healthcare costs are rising, pain is still there, and we don't know really how to solve it. Not just temporarily. And we are world-class masters in solving the symptom, but we are not good in prevention. And the thing is, because we don't understand why and how, and how to make it easy. So the good news is iPlena makes it simple. And this is also the USP from all the other devices or all the other solutions that we currently see on the market. It's easy. It's easy for the practitioner. It's easy to understand for the patient. And it's really motivating for the patient when he sees his first results after just a 3-minute training. And for me, it's not just a tool, it's my mission. And it's also my background, not just from my childhood. Also, I'm lecturing in physiotherapy schools and for other osteopaths internationally. I speak 4 languages, and one of my favorite countries where I educate osteopaths is also Ukraine. And so actually, what makes this tool as a game changer is that it's not just an AI that is make an automatization of a process that is already there. It's an AI that is combining with a completely new method to solve posture problems and pain. So what we are looking at in the market is that the global physiotherapy market is huge and it's rising. So if we're speaking about the healthcare spend per capita in US, it's like 10K per year. And most of it is for orthopedic, physiotherapy, and for example, new joints. So what we can do is we can use this market really well with our solution, and our team is able to do it. So we have specialists from IT, we have specialists from sales, and we have specialists from healthcare. And we have an orthopedic doctor also on board that was also in Miami. Thomas know him. And so actually, this team makes it all possible to create this great solution. And what makes us different from all the others on the market, because I think many of you know digital health solutions also for pain management or solving pain. So what we're doing is we're giving therapists a tool, not to replace them. We're giving therapists a tool to making things happening faster. to make things happening holistically. So we're not just solving the pain, we're solving a whole posture that is the reason for the pain. So for example, if I have one shoulder more up than the other, then I can massage my neck really long, but the pain will not go on. And this is how we work. So we make an immediate personalized recommendation. The therapists spend less time with the patient, but can get the same value of money. In Germany, it's even better. In Germany, they can even go to the insurance, and with our scan, they can charge the insurance over 60 euro. So, and that money they make in 2 or 3 minutes. So this makes our solution, for example, the DACH region, really, really, really high product market fit. And how we also help practitioners to also work differently. Because if we look at this picture, so what we see here is that many of you have this problem, that many of you, when they are starting to run or starting to walk, they have hip instability, for example. This is just, in this case, you see what a different muscle function in one place can make with all your muscle function, all your posture, all your body. And this asymmetry is one of the biggest reason for pain, because if you think about pain, you don't have pain on both sides at once. You have pain entirely on one side. And this is also why we have to work on this balance and not just on posture from the side. And what is our business model, how we're generating money? So from now, we're generating most of the money with pay-per-scan model with the practitioners. And this is also something that is really simple to understand also. So you make a scan with your patient, you pay us $9, you generate over 60 euro, and then it's an easy to understand business model. If you go also to, for example, in companies, you sell our scan, for example, for $40 or $50, and you pay us $9. So this is our business model. So we enhance practitioners to make better treatments, to make it easier, and to generate an upselling option. And subscription is the option that is like upselling after the scan. So when we make the scan, when we generate the report, there is also the option to join our app. And if the practitioner sell our app through his channel, he gets also a good provision for the patient using our app. But what I want to say is that with pay-per-scan, we generate now like 95% of our revenue. And yeah, so this is also our go-to-market strategy that works really well. I will come in one slide to our traction, and that is also based on this. And yeah, so actually we see in the market that practitioners, medical trainers, every of them love our product because it makes it easy for them. They can generate more money. It makes it easy for the patient, and it makes a great result for the patient. So it's a win on all sides. And for example, also the insurances now are more interested in our solution because now we can show them track records of the patients that already use the app and they have less pain. So this is now our way to go and how we want also to expand. And if we show, for example, just the timeline where we was in Caelestinus, then we make the greatest traction ever. It was one of the biggest differences that we make is we don't approach the direct to consumer. We now approach just the B2B partner. We make not B2B2C or something like this. We go just to the B2B partner, to the practitioner, medical professional, and the 8,000 accounts that activated, that are the end customers. So for example, if you have 300 practitioners, we have for now 8,000 accounts activated. And with normal ways to get 8,000 accounts activated is it's really huge marketing spend. And yeah, so for now, this is the best way to go also for us. So we conducted a lot of posture scans. And if we look also that we have some accounts that make the posture scans by themselves, so we don't count them. So for example, if we have here 8,000 activated accounts, that are the posture scans that are just made from practitioners as themselves. So over the half of the posture scans are made from home, from the users. And this is our new branding also on the market, PhysioScan. And this is the posture report that we're generating with the help of just 3 pictures. And yeah, we're now really specialized in this product because it has a really, really fast time to value. It has a really, really
Now we lost the audio. We lost the audio, Alex. We can't hear you. Yeah, we can see your screen, but we can't hear you. So you have still 2 more minutes. Yeah, now, yeah, you're
Okay.
back. You're back, but you have 2 minutes, including questions. So I suggest if you
Okay,
can close
okay.
your pitch.
Okay, so yeah, we're raising 600K for now, and let's make the world healthier. Thank you very much.
Okay, thank you, Alex. Maybe if you want to repeat how much you're raising right now, 600K?
600K we are raising. We already raised 300K, and yeah, so now we are raising our seed.
Right. And if I understood it correctly, so your product is about scanning the scans that you show us. There is a question on Slido that physiotherapy depends on performing exercises properly. How does your product, if it does, help people exercise properly?
So this is why we changed just to the practitioners. So the practitioner give the exercise to the patient. So this is the way to go, and not that the patient make it all by himself. So the patient make the scan by himself, but the explanation and the recommendations are going to be explained from the practitioner.
Okay, giving practitioners more opportunity for additional services, added value, and more income. Okay, so do we have a question here in the audience? Yes, Honza? You should hear it.
Yeah, hi. So since you're based in Germany, are you looking to join DIGA, the program for...
So we have another option for reimbursement. We not need to be a DIGA, and DIGA is also not interesting for us because we have to delete the data after 3 months. So we're collecting the data and don't delete it.
Okay, and last question from Peter here. What do you aim to achieve using the money you raise in the seed investment?
So for now, we want just to make our sales working better in other countries, because for now we have a good sales team in Germany, and here we have a lot of sales, lot of traction. And in other countries like Switzerland, Austria, and so on, where we have also the good product market fit, we need more enhancement in sales and also the R&D process. We want to invest more to get better, and that's what we do.
Okay, thank you, Alex. So that's it. Fingers crossed, and I hope to meet you soon without any pain, of course. But if there will be pain in my other shoulder, I know how I'll ask you to fix it again through your physio scan.
You fixed it. I don't fix it. You fixed it.
Okay, thank you, Alex. Thanks for tuning in.
Bye.
Bye-bye. So we have 3 more pitches to go before our break, and next one to present is DX365, and we should have Alexander online. Alex, I can see you, and if you try to say a word, any word, we'll confirm that we can hear you. We can see your screen very well, but I can't hear you.
Okay.
Now it's perfect. Now it's perfect.
Very good.
So the stage is yours. You have 13 minutes. Try to leave some time for questions. So I recommend to around 6 minutes should be ideal for your pitch. Okay, so Alex and DX365.
Hello, my name is Alexander. Thank you for joining Caelestinus. I like to present my startup here, and thank you, InterSystems also. We have developed a diagnostic infrastructure, can measure a lot of different parameters, just only use one device. Imagine now you can run many different parameters, not a lot of like a glucometer unit or maybe a lipid panel measurement or hemoglobin measurement. You just use only one device. And it's our vision. And today we already run 145 piloting in many countries, 10 countries. The main piloting in pharmacists or fitness centers. And the main reason is better services or better sales. And what we solve problem is a lot of devices now exist in one with one single application. And your results is not easy to access to your one market, your one place. Also, no single test manufacturer produce good test with good quality and good price. And it's not easy to get results. You need to special place, for example, to get venous blood. It's better to use only capillary blood in future. And a lot of patients need remove control of some parameters like thyroid hormone or diabetics, and helps to do it also. And our solution is a very small device and very beauty. You can place in your everywhere you want in home. And we have a good sharing system of the data with different application. And we also can create idea to schedule some supplement intaking and track some parameters. How does it work? Imagine now you go to pharmacy, and in pharmacy you can run any type of test. Then use Caelestinus and InterSystems. We can transmit data to different app application, depend on what is your goal. For example, if you work with diabetics, you need application for diabetics. If you work for fitness, you need fitness application. We share the data, use InterSystems, and then depend on application, we can change something. Next slide. Okay, our product is a device, can read up to different 100 parameters based on lateral flow test. And idea of device is a combination two different technologies, and operator application and customer application. And our business model based on device selling and revenue sharing based on a commission of sell tests. We have a lot of opportunities for tests. And also we have commission based on people invite to our ecosystem and sell different services like supplement or additional service, medical services. Market size interesting for chronic diseases is pretty big, and also for supplement deficiency. It's some statistic how often you need to control of supplement deficiency, for example, and statistic how often you need to control some chronic diseases. And yeah, we're almost ready. We have 5EDR certification of device. Our application is ready, and we developed also valid for collect of your health data. And we adopted already 20 different type of tests in Berlin lab. We have a wide of different partners in different areas, different applications. Yeah, I would show you also our computer analysis. We have benefit according to this price compare with different devices, also number of possible tests, just only one device, and easy to use, and possibility of multiplexing, because we can read a lot of different parameters, just only one strip or one test. Our team is really cool. Today we have Dmitry also here in demo. We have a CTO, Philip Mitrofanov. He working device manufacturing in Germany. And we work with the IFLB lab in Berlin. We check every test and check quality. Today we have special price. Everybody would like to buy device with 5 different parameters. For example, cortisol, ferritin, vitamin D, COVID antibody, and testosterone. We have special price for that, 299 euros. Okay, thank you very much. If you have any questions, I would answer for all of them.
Okay, thank you, Alex, for your pitch. So how can I buy it if I wanted to buy your kit? I'll
just go to my website and
and order it. Okay,
yeah,
I'll actually order one. But
yes, it's a really fun.
Am I your key customer, or who is your key customer? Is the first question on Slido.
My key customer today is a pharmacist, small labs. For example, previous COVID centers before, but today they would like to do some different diagnostics and rapid diagnostics. And for example, fitness centers, because you can help to control some parameters and help to increase your physical parameters better.
Mm-hmm. Right. Questions? Honza?
Hi, could you maybe tell us a bit more about what were the results from the pilots you have? Some feedback from your customers and stuff like that.
The main feedback is they like our system. They like our device, very simple, also simple to use, and our challenge is create delivery or logistic system of test and adopt all tests available on that from our suppliers. And we would like to create like a shop, marketplace where you can go to and buy what type of test you needed. And yes, main disadvantages today is the customer not easy to buy test and order it.
Okay, are you raising any round currently?
No, yet. We just selling devices to buy 299 euros.
Okay, if there will be new types of tests, how can you upgrade your device for those?
Today, we almost covered 60% of possible laboratory tests. Also, we covered with biochemistry. We have very good test for 9 parameters, just one drop of blood. It's a biochemistry test for lipid panel, kidney, and IST-LT. Yeah, it's a lot of test appears in the market every day, and new tests can be interesting for new possible areas. Also, good areas for us is veterinary. It can be also interesting for dog and cat checking.
Okay, fine. Where do you produce your device? In China or India?
In Berlin.
In Berlin.
Yeah. To Germany, it's a pretty easy to produce because we created simple to assemble device because we would like to minimize cost as much as possible.
Okay. So we have one question here, IKEM. Osman.
Hi, do you have a certification of the product as a health device?
Yes, we have IVDR certification class A and CE mark also. Our device is low risk class, and the main risk is the test itself. Test usually is a B or C class. For example, vitamin D is a B class. Different tests, for example, ferritin, I think it's a C class, yeah. But our device itself is a low risk class.
Okay, fine. One last question, anyone? Yes,
By the way,
better. We have one more here from our audience.
Hello, thank you very much for the nice presentation. Very quick one. Maybe I'm just amateur and don't understand it much, but what is the added value of having the reader when you can read the test itself without the reader?
A lot of tests is not visual control. A lot of tests need reader because it's a fluorescence time resolved. Because now standard is changed. Before was only visual control. Today, a lot of test appears is based on time resolved fluorescence because it's better sensitivity and less and better accuracy and dynamic range pretty good. And why we developed device can read buff test, existing one on the market and appears in the market new one. It's a fluorescence.
Okay. Fine. So thank you.
Thank you very much.
Thank you, Alex, for your pitch, and I'll order your device tomorrow because tonight we have a party. So expect my order tomorrow, not today. But I'm really excited about it.
Thank you very much. I place order link in a Discord channel.
Okay, thank you, and fingers crossed. Right, so we have two more pitches to go, and next one should be joining us online, and it should be Jenny. Hi. Can you?
Hello.
Yeah, hello. We can hear you. Perfect. We can see you. And Jenny will present AcuSense biomedical technology. So we can't wait for your pitch.
Okay, perfect.
Yes, we can see. Yeah, we can see your screen and we can hear you perfectly.
Okay, perfect. Thank you. So hello everyone. My name is Jenny, and I'm here with AcuSense Biomedical. So our mission is to improve patient safety and support medical professionals with AI and IoT technologies. We assist hospitals in digitalization by providing a comprehensive solutions through both our hardware and software. And our in-house products include Reminder Tourniquet, IDH AI prediction system, and Rockbox IoT gateway. In addition, we also offer technical services and a range of sales products. So a bit about our current status. We are a Taiwan-based company with a team of 6, including international partners. And our focus is on worldwide expansion, with M&A as our ultimate exit strategy. Our customers currently include medical centers and hospitals in Taiwan and international hospitals. Our revenue last year reached 100,000 through technical services, product sales, and hospital projects. In our current expansion phase, we're actively seeking funds with 2 doctors already on board as investors in this round. So as mentioned previously, these are our 3 main products, and they're already in the market contributing to our revenue. The Reminder Tourniquet on the right, is gaining traction with numerous repurchases order from hospitals. And IoT Gateway has already secured a pre-order sale for 700 units next year. Meanwhile, our AI IDH prediction system is undergoing clinical trials in hospitals across Taiwan. And today we'll be focusing on this product. So what is the current challenges in the dialysis field? Focusing on our three main stakeholders: patients, nurses, and the hospital. For patients, the high prevalence of IDH during dialysis poses a threat to their well-being and quality of life. And the lack of timely intervention not only exposes patients to increased health risks and complications, it also amplifies the workload for nurses. And for hospitals, unplanned hospitalizations stemming from IDH significantly contribute to escalating medical costs within the healthcare system. So our mission is to address these challenges and enhance the dialysis experience for all stakeholders through our innovative solutions and proactive interventions. So traditionally, nurses will have to monitor patients on a regular 30 minutes interval. And when they sense that the blood pressure drops below 90, the caregivers will have to experience to decide on a treatment for the patients. But with our solution, we revolutionizes this process by providing an advance warning to nurses, and this will prevent IDH from happening. So this is a demo of what our system looks like. It is a multi-bed monitoring system, as you see here. And in this demonstration, we'll be able to monitor 8 patients at the same time. So when our solution predicts that a patient will encounter IDH, it triggers a warning signal. In this case, it's red. And additionally, our system also provides a numerical prediction by forecasting the patient's blood pressure after 30 minutes. And as you can see here, it also shows the probability of the occurrence of having the IDH. So far, we have successfully implemented our system at 3 hospitals in Taiwan, and these are the results of our AI model prediction. And the clinical study conducted at our partner hospitals has also demonstrated the clinical efficacy of our system. A comparative analysis of the IDH incidence rate in 2022 following the implementation of our system and the previous year revealed a remarkable 34.5% decrease in the incidence rate. So this underscores the positive impact of our AI-driven solution in mitigating the occurrence of IDH and enhancing patient safety during dialysis. So now we go into our market size. So the market potential in the hemodialysis sector is substantial, with the global market valued at $35.5 billion. And targeting our key regions such as Taiwan, United States, Europe, and Japan, we estimate a market size of 356 million. Furthermore, with a robust compound annual growth rate of 5.2%, this field continues to exhibit sustained expansion. So our business model eventually is to target insurance companies, recognizing the substantial cost implications of dialysis-related incidents. So for a dialysis clinic visit, it costs around $270 USD. Visiting ICU and hospitalization can soar to approximately 9,000 USD. So by preventing IDH through our innovation solution, we aim to significantly reduce these additional costs, presenting a mutually beneficial proposition for healthcare providers and insurance companies. And we're in the process of expanding our collaborations. Having partnered with 3 hospitals in Taiwan, this marks as a strategic move as we actively contribute to the development of a comprehensive smart dialysis ward in the region. And expanding beyond local collaborations, we have established partnerships with hospitals in various Asian countries, including Japan, Hong Kong, and Singapore. We're actively pursuing FDA approval with the goal of completing the process within the next 3 years. Following successful approval, our strategic exit strategy involves seeking M&A approval. So why do we think we have an opportunity to be merged? The opportunity for merger and acquisition arises from the current market trends. As indicated by the news reports in 2022, there is a trend among large companies seeking to merge with innovative unicorn companies such as ours. So we're actively seeking funds to support our endeavors in regulatory compliance and global expansion. In the current round, we have successfully secured $350K USD, and we're aiming to raise a total of $1,000K USD. Additionally, we're also in the process of applying for support from the National Development Fund in Taiwan to further increase our resources. So our goal is to enhance patient safety, and we invite you to join us on this transformative journey. As we continue to expand our markets, we're eager to collaborate with hospitals, dialysis centers, and companies specializing in AI and IoT. Together, let's make a lasting impact on healthcare through innovation and shared commitment to patient safety. Thank you for listening.
Thank you, Jenny, for your pitch. Are you joining us from Taiwan?
I'm currently in the United States for a business trip.
I wondered, like, is it late at night? So
it's early morning. Yeah,
it's morning. Okay,
yeah.
thank you. So let's go for questions, either via Slido or here in the audience. We have Honza.
Hi, could you please tell us more about your monetization strategy? I know you mentioned insurance, but you said you aren't currently insured, so the hospitals are paying in themselves, or what's the situation around that?
Yeah, so currently we're working with the hospitals, and we also do B2B with other hospitals. But in the long term, at the end of our business model, as our goal is to work with dialysis, is to work with insurance companies. Right. Yes, sorry. Does that answer your question? Yeah.
Thank you. Another question? It looks we have no more questions. So thank you, Jenny, for your pitch. Sending my regards to you to the US right now, and fingers crossed. And thank you for taking part in the final demo as well as our Caelestinus program this year.
Yep. Thank you.
Okay, bye. Thank you. Right, and we have one last pitch before our break here. And the very last one to join me here on stage is Lukáš. So it's my pleasure to welcome Lukáš Lón from MAIA Labs. Hello, Lukáš.
Hi.
Nice to see you again.
Hi, thank you. Good afternoon.
And Lukáš will be pitching Biomedical AI assistant. So the stage is yours. I'll give you
please
the clicker.
It's possible, or if AI use it instead of me. So good afternoon. My name is Lukáš Lón, and it's my pleasure to introduce you MAIA. The problem which we are solving is listed in top 5 expenses for medical care for all Western countries, and it's colorectal cancer. CRC is the second biggest cancer killer. Every 3 minutes dies one European because of this disease. And CRC arises from adenomas, and adenomas are looking for doctors during the colonoscopy. Unfortunately, even experienced doctors don't see 20% of the adenomas. And here you can see the reason why don't see so many adenomas, because the environment is so dynamic, still moving. Some liquids are splashing around. And what is difficult for the human can be easy for technology. Therefore, we developed MAIA. MAIA is AI-based endoscopy module, and MAIA can help improve quality of examination, so increase adenoma detection rate, and in the same time can speed up examination by up to 20%. So now you can see how does MAIA work. If you can look on this segment, you can see for a while green bounding box. So the doctor is alerted by beeping that some adenomas. I will play it once again. So there was really for a while. Now was the small green box, and the doctors hear the signal and he can check it and go back. What does MAIA do? MAIA can detect in real time plastic and flat lesions. MAIA can classify them so that in the real time, so the doctor can act immediately, measure the size of the lesions, including inflammatory diseases like ulcerative colitis or Crohn's disease, and in the end generate a report with all of the findings which was during the examination. To be able to work with this technology and to be able to gather the data sets, we developed our own hardware. This hardware is built on AI models from self-driving cars. So it's really powerful. It comes from the automotive, so the voltage level is for 12 volts, so it's really sustainable because the consumption is 10 times less than a similar solution. But what is most important that our MAIA is compatible to any endoscope on the market. So installation is really fast. We just connect MAIA box to the endoscopy tower and draw the bounding box and information on the display. And there you can see the installation, how does MAIA look after the installation in the hospital. Our product we divided to one sub-product. It's a medical device category 1. It's an AI recorder. So in real time we can enhance the video from the endoscopy. We can use the AI enhancement of the video, AI adaptive content bitrate, so we can reduce the size of the video more than 50%. And we can create important statistics for the doctors like Boston bowel preparation score, seeCOLe detection and withdrawal time, tool detection, and all findings during the endoscopy, which are prepared for one medical report. Our flagship is AI Assistant, so the function which I mentioned before, it's classification or detection, classification, measurement. We are already working, we have a pilot for a colonoscopy, we are already working for the gastroscopy, we are gathering data from the urology. We will start soon with the bronchoscopy, and what is the newest segment where we step in is gynecology with the hysteroscopy. Who we are? We are a team of, we work with many university hospitals in Czech Republic. We have already pilots in Czech Republic and Slovakia, and we are open to cooperation with other hospitals in the Czech Republic. Who we are a team, experienced team from developing AI application. We have experienced from industry and transportation, and there you can see the core of the team. Associate professor in neural networks, Michael Hradiš, myself, I have experience from the international sales, and Peter Musil, who is excellent developer, AI developer of AI application. So I don't know if we are out of the time, or shall I continue with the technology? What is unique on our solution that we are not using just a single frames technology like other technologies in computer vision does. We use the contextual neural networks. So we aggregate information with previous frames, and our algorithms is decided after this information is aggregated. So here you can see the tool, annotation tool. So for the doctors, it's much easier to learn some new objects. This is web-based application, what you can see behind me. And doctor just mark the finding, and he doesn't need to remark it for all of the picture. It's automatically redraw to the next pictures. What we can do with the video, that we can track the optical flow. So we aggregate the information from whole examination, and we can compare the same patients in the different times. So when the patient has a colonoscopy half a year ago, it's almost impossible for the human to compare two videos, because these videos will look absolutely different. So he needs some point how he can recognize that he is in the same part of the colon. What we can do, we can just create the digital twin of the colon, and we can help to navigate him. What we can do, we can in real time do with the optical flow some 3D reconstruction. So if the doctors would want to have some better imagination of the findings, so we can help them. They just step the foot switch, and we can show them this 3D reconstruction. So I think that time is over.
For letting us look into someone's colon. And thanks for the lovely pitch. Now let's go questions. You can use Slido, or I'll take questions here from the audience. So we have Honza, our traditional first one to go.
Hi, so could you maybe tell us a bit more about your differentiation from competition? Because I just recently saw an Israeli company that does something very similar, and they have FDA approval already. So
yep.
Could you tell me more about that?
Yep. There is more than one competitors. We have on the radar 10 of them. Most of them are working on the same use case as we do, but they're using the different technology. They use just the classical convolutional neural networks technology, and we use the contextual one. So the difference is that I explained on the hand. So if you want to learn to detect the hand, you need a picture of the hand. Someone has to annotate it, so he has to redraw the shape of the hand, train the algorithm. After that, hand is on the picture, an algorithm will detect. When the hand is in the different shape or position, will not detect. And that's the difference with our technology. Beginning is the same, but when the hand is moving, we still know that this is the hand, and it don't need to be visible whole hand. We still know that our algorithm knows that this is the hand, and that's the difference. So we are open the new era with the colonoscopy, that we can tracking something which is inside the colon. We have much lower false positives than the others, because, for example, in the colon, during the colonoscopy, there are some air bubbles. If experienced gastroenterologist saw some picture with the bubbles in wrong, let's say wrong conditions, he for sure mark it like a polyp or like an adenoma. And the other system, which just evaluate frame by frame, they do it so often. But we see that this bubble is moving, it's growing, and so on. So our algorithms will not detect it or mark it as an adenoma. So this is the basic differentiator. And we do much more with our initiative, like generating medical report. So when we something detect or classify, we prepare the medical report for the doctor, and he just validated what he wants to have in his medical report. And we have other features like speech to text and so on, but it's not so unique.
Okay, we have a question from Slido. What are your sensitivity and specificity within adenomas? You said that you have lower false positives. What about false negatives?
This is a good question. My colleague, who is an associate professor from the university, always say this is not the correct explanation regarding such kind of application. What is the sensitivity and specificity in such a case? It all the time depends on the quality of the data set. We have better results than the competitors, as we can as we measured in this specificity and sensitivity. Specificity, we have 97.4% on the dataset. Sensitivity we have 98.8, something like that, but it's not the correct one. We want to have a comparison study now with a Fujifilm system. So in the first quarter next year, we will do in Hradec Králové University Hospital studies when we will benchmark it with already the best solution on the market from the Fujifilm.
Okay, fine. More questions? Still have 20 seconds.
Jordi. Not now.
Okay, so in which case, let me thank you, Lukáš, for the great pitch.
You're welcome.
And let me invite you to join us in our break outside. Welcome back, everyone. If you are watching us online, welcome back. We had a great break, and we are ready to go with 1, 2, 3, 4, 5 startups. So it should take us just over 1 hour. And the first one to present is Jan Richter from DoctoLink. Hello, Honza.
Hello.
Hello, it's my pleasure to have you here. So I'll give you the mace of destiny. And
thank you.
Stage is yours.
So, can you hear me well? Thank you, and good afternoon. Thanks for coming back from the break. And I just want to start by thanking the organizers. And this is where I should.
Yes.
Okay.
No,
okay.
This one. That's the spot. Excellent.
Really? It should be red, no? Okay, I will keep here then. So thanks a lot again, and I just wanted to say it's a privilege to be in this company of great startups. So I'd like to introduce what we are doing. Did you know that Czech diabetologists in total waste more than 400,000 hours per year working with the data and doing manual data manipulation? If they had better tools, they could save most of the time and use it in a much more productive way, like treating patients, treating more patients, or anything else. This is almost 200 FTEs, which in a country like Czech Republic is super significant. So let me dive into the details, what that means. So that huge number is actually 10 minutes wasted per each patient visit at an outpatient diabetologist office. And that's the time that the medical specialist spend collecting, manipulating, moving from place to place, printing out, downloading, and still very often manually typing the data of the patients. And that's simply because there is no single place they can go to and find everything that they need. No, there's actually lots and lots of different places. So there are dozens and dozens of different devices that are basically sources of this data. So it's various types of glucose meters, smart insulin pumps, smart insulin pens, self-reporting apps and others. And they are very often coming from different manufacturers, and every manufacturer typically has their own environment and ecosystem of applications and websites where these data resides, and they are not working very well with each other. So this results in up to 10 different systems that an average medical practice has to use to find the data that they need. So this ranges from glucometer downloading software, different websites, reports, but also traditional communication tools like email, SMS, and last but not least, very often still used paper logbooks. So how can we solve this? how would an ideal solution look like? For us, the best would be if there was just one place where the professionals can go to and find everything that they need. And this is exactly what we are proposing and that we are building. This is the all-in-one data management platform, a platform that automatically does all the data handling, collection, and integration, and provides the data in one place. Also, and this is something that is not part of the solutions that we see on the market, it should be really covering all the patients for the practice without exception, which means that the benefits then really are realized. And by doing this, we want to save as much as 80% of the time that is wasted today. So where are we on this journey? How far have we gone so far? We have started by validating a first module on a market which is covering one very typical use case. And this is patients coming today with data self-reported on a paper logbook. So by putting that online and putting it to the mobile, we are seeing that practices using this solution are already saving 5 to 7 minutes per patient visit for this specific use case. This is just the first element of the big solution, but already we are getting very good feedback from the market, and we have reached already paying customers. So let's look at our KPIs. We have launched in April this year, and today, 8 months since the launch, we have got 61 leads, 19 practices that have started to test the solution, 450 patients onboarded, and most importantly, we already got 8 paying customers. This is on the Czech market only where we operate. So we are quite happy with these numbers. And again, let me kind of recap. This is just the first element of the full solution without all the benefits that we want to see in the full solution that we will launch later on. Just very quickly talking about the magnitude of the problem that we decided to tackle. So diabetes is very expensive. Globally, its treatment and management costs about $825 billion. $8 billion out of that is actually our 10-minute per patient visit cost that could be saved. Czech Republic is obviously a very tiny part of that, but still the cost of that time is coming to a whopping $17 million. This is what our roadmap looks like. So today, as said, starting with the Czech Republic, we already achieved first paying customers. For next year, what we want to do is to launch additional modules towards our solution, and obviously keep validating intensely with the customers that we have. And if everything goes well, later next year or the beginning of 2025, we would like to reach a product market fit. And at that point, we would like to raise money to launch a scale and enter selected other markets in the EU. This is our team. We believe we have a right mix of medical and technical expertise and business expertise to be successful. And with that, I would like to thank you for your attention. Thank you.
Thank you. So thank you for your pitch. Let's go for questions. So again, you can use Slido.
Hi, so I have two questions actually. The first one is competition. So have you looked at similar stuff happening in Europe? And the second one is going to be around monetization. You said you have 8 paying customers already. So who are they? What's the kind of the details about that, and how do you expect that to change if you maybe expect to be paid by insurance in the future and stuff like that? Yeah.
Okay, thanks. So the first part of the question, competition. we really feel that the biggest competition is really the status quo. What we see visiting the practices that they are really kind of using all these different tools. Obviously, there are solutions who are promising to centralize that. First of all, we really don't see them being successful, at least in the Czech market, but this is coming. But the most important difference is that they are point solutions. So we have not seen that they would really be fulfilling the promise of covering all the patients for a practice. So they are maybe partially solving the problem, but they are point solutions for certain use cases only. And what we want to do is to really take a kind of customer-centric approach around the practice and build a solution in a way that can really cover and fulfill that promise of save time. So that's the main difference, but obviously there are systems like GluMCo, Diabetes Tidepool in the US and so on. So there are many in this space, but it's a huge space as well. And the second part, so at the moment we are basically having like a validation business model. So it's very simple. It's a monthly fee per practice in a SaaS model, and we charge 40 euros per month. And this is really just to kind of test the willingness to pay and use the solution. So what the kind of target pricing will look like, we still don't know, but this is for us good enough to basically see the feedback in reality on the market.
Perfect. Another question? You can use Slido, or your hand, or your leg. Yeah, we have better. Just if you could wait, please, for the mic. Thank you.
Thank you very much for the presentation and a sensible approach. I like that you already have the paying customers. However, I would be more interested those that didn't convert. What were the reasons? If you can cover that, thank you.
Yes. So as I said, what we've built so far is one use case, and this use case is not universal. So some practices, because of lack of time, they are not asking patients to use and self-monitor today. So I would say the biggest reason why we have not converted all the leads into paying customers is that the practices are, this use case is not relevant for them. But to add it, I think it's really a combination, because every practice is different. We see that they are quite unique in the way they approach the customers, in the set of devices they are using, what kind of customers are coming to the practice. So it's not so kind of black and white, but that would be the number one reason. Yeah.
Fine. One more. One is not enough.
If no one asks. So how about the úhradová vyhláška? Do you see some way to be somehow paid because you are increasing the efficiency of the system and so on and so on?
Yes, so we are obviously not directly reimbursed today, and this is an interesting question. I don't think that for the foreseeable future that's the path for us, because we are the efficiency tool, and this is typically not found in the in the reimbursement scheme, at least not here in Czech Republic. However, of course, we are indirectly paid, because if we allow the doctors to treat more patients, that's of course the way for them to make more money, and then they can cover the cost of our solution from that as a margin. So yeah.
Right.
And by the way, maybe just a small comment, because this is really a pressing issue. I'm not too sure about the other countries, but there is a shortage of professionals in this field. The number of diabetes patients is rising steadily, so it is quite a burning issue. And also, especially right in Czech Republic for next year, it actually seems that there will be even less money to coming into the insurance. So being efficient for the practice is paramount for them to be able to operate.
Okay, so thank you, Jan, for your pitch. It's been a pleasure to cooperate in Caelestinus, and thanks for this presentation. We will now be moving online again, and hopefully we have Karel joining us. Carl, are you there?
I'm here.
Excellent. I can hear you very well. It's nice to hear you again. Hopefully we will see you in a short second. It's hi again. It's a pleasure to have you back. Yeah. Where are the glasses? Whenever I see you, you wear your glasses.
Oh, my glasses are always with me. They're here.
Excellent,
I'm
excellent,
ready.
Carlos. So, Carl Osborne from seeCOLe, and the floor is yours for the pitch.
Thank you. All right, let me share my screen.
We see your screen
And so,
perfectly.
all right, awesome. Thank you. And so seeCOLe is an augmented reality health application where we strive, myself and my colleague, my chief medical officer, Dr. Sherry Soltini, we strive to humanize healthcare through technology by empowering clinicians to just be clinicians, and in return, enriching the lives of the patients that they perform physical exams or they're accessing their medical records. Just like my colleague said previously, there are worldwide issues, and as electronic health records have a lot of data, we find that clinicians spend a little bit too much time going through that data, documenting, reviewing results, and less time actually with the patient. And as you see in the news, this is a worldwide phenomenon that clinicians often feel burned out, that they have to not only take care of patients that are more patients than that are on their care plan, but they also have to look at this information within the EHR. And as a result of this, through burnout, we find that healthcare and hospitals spend billions of dollars in loss of staff. We saw that during the COVID-19 epidemic, and also unmotivated new clinicians that find that they're spending way too much time away from doing clinical work and more time just becoming data analysts in the EHR. And so with my journey as an EHR analyst, I asked myself, well, why do clinicians have to navigate to a workstation? Why can't health information come wherever the clinician is and follow the clinician while taking care of patients? And so seeCOLe, which stands for See Clinical Data on Lens, was created. And what it is, I'm right now wearing Google Glass. Another vendor that we work with is also the View 6 Blade, which I'm holding in my hand. And these are augmented reality glasses that are integrated with the EHR, powered by InterSystems Iris for Health. And clinicians can walk around with these glasses and verbally access any clinical data that pertains to the patient, such as if they want to trend the A1C of a patient, show me which patients have a risk for sepsis. That information, through voice command, populates within the viewpoint of the patient. In addition to just accessing clinical data, clinicians can also dictate. A little bit different from if you're familiar with Dragon or any of the dictation tools. The difference with seeCOLe is you, again, powered by FHIR APIs, a clinician can update the diagnosis of a patient and it goes precisely to that section of the EHR. Notice that I not have any tethered devices on me. It's all wireless, powered by the hospital's Wi-Fi. It's compatible, so clinicians can fold it and put it right back into their lab coat. And again, the premise here is that it's hands-free. We're giving clinicians back their hands, enabling them to not only interact with the EHR in real time, but also care for the patient or proceed with a procedure and not risking any sort of incidents that may occur when they have to navigate away from the EHR. Some of our other capabilities are also, we have AI. I'll explain a little bit of our newest AI solution that we worked with InterSystems on. But our AI our diagnosis assistant listens to what the patient's chief complaint is. We find this in the triage scenario, or maybe fast care or urgent care, where the glasses is actually listening to what the patients are saying And through an analysis, as you can see here in the screenshot, it will give the clinician a probability of what the patient is there for. We find this as a great tool to speed up that process, especially in the states where a lot of urban areas have a high risk of volume of patients coming into the ED. This kind of cuts it in half and reduces redundant questions that clinicians may ask. Another capability that we have here is through the glasses, it also has a camera, speaker, and microphone so that clinicians can do clinician-to-clinician consultation. Not everywhere in the States do hospital systems have a specialist, and so we find that there are two use cases where a hospitalist can talk to a consultant, and that consulting provider can now look at the live feed and also give their kind of opinion. Another use case is for the resident attending scenario, in which where an attending is performing a procedure and residents can actually see that procedure in real time and actually get that hands-on learning, that virtual learning, as we're all familiar with now post-COVID. Again, all of these mechanisms, we look to saving clinicians time, which also improves productivity, and also the most important thing is improving patient satisfaction. As I mentioned, our two devices, Google Glass Enterprise and the View 6 Blade, are our devices of use. Yes, Google Glass are no longer in production, but there are a lot that are still made, and we actually have a deal with Google to ship them anywhere worldwide. Where we see this utilized in our use cases are in the ED, surgery, isolation rooms where you don't want to touch a lot of surfaces, hospitalists, and ambulatory care. As I mentioned before, we are a little bit different from the dictation software only because you can actually look at the clinical data on the go versus our competitors here where you have to navigate to a particular workstation and then you have to stay at that workstation. Our journey, we started in 2018 and we've integrated with various healthcare systems and EHRs in the States. Thanks to the accelerator and to InterSystems, now we're branching out. And I'm happy to say in 2024, we actually sealed a pilot with the country of Israel, who is going to utilize our software in their OBGYN specialty. Speaking of InterSystems, we're very grateful for the opportunity once again for the accelerator for introducing us to InterSystems, because one of the things that we found out was a new feature, which is what we call MAIA. MAIA stands for Medical Assistant and Research System. Through InterSystems Iris for Health, we're able to pull FHIR APIs and have it live right on a particular database. And the end result is that now clinicians can query by voice command anything that they want within the EHR. Imagine a clinician now walking around and asking, please produce the probability of my patients who have a risk for diabetes. Or let's do a more trend analysis on a particular lab result. FHIR cannot do that, but with InterSystems Iris for Health and FHIR, now we're able to do true AI analysis and research analysis on the go and having that data within the viewpoint of the patient. It's truly extraordinary. We're looking forward to deploying it out. Our awards and recognitions, we've won awards from everywhere from Google to Cerner. We've been featured in Entrepreneur magazine and various health IT magazines. Our partners have been Google, View 6, Cerner, Epic. There are EHR companies here in the States, OpenAI, which is where we were first dabbling with MAIA, but we're very grateful for InterSystems and really exploring their Iris for Health. And we've definitely came up with a game plan on how to introduce MAIA. So we're very grateful for that partnership. Licensing and pricing, right now we're still looking for pilots to kind of trial MAIA and to trial our use case. Our team is made up of an EHR consultant, a provider, and also an augmented reality engineer. So we thank the accelerator for allowing us to share this platform. We are very grateful for InterSystems and their technology for challenging us and to generate a very game-changing application. And we thank you.
Thank you, Carlo, for your pitch. It's been nice seeing you again virtually, but you've done a great job over the past 8 months in Caelestinus, and it's now our turn to ask questions, either here at IKEM or if you are online, use the Slido channel. So, okay, first question.
Hi, so could you please give me some more details about the product or service you are providing? Is it just the software, or are you also having it with the service of the Google glasses, or what's kind of the sales of that, because you need both the glasses and the software? So how do you push that to the hospitals?
Right. So when we're talking about sales, it's direct business-to-business sales. We sell to healthcare systems on a subscription basis. The devices are included in our sales package. As mentioned, we do have a standing relationship with the View 6 Blade and also with Google Glass vendors. As I mentioned, Google doesn't produce the glasses anymore. And so they have partners worldwide that actually has the Google Glass. Right now, I'm wearing the latest edition, Google Glass Edition 2. It's sleeker, it's faster, and it can generate more data versus the previous models. And so there are a lot of preferred vendors worldwide, 2 of which we have a direct partnership with. So let's say the country of Israel, and the pilot goes very well. They would use seeCOLe on a subscription basis. We would preload them with the devices, whether or not they want to use the View 6 Blade or the Google Glass. We would load it. We would provide the training. And again, the great thing about it is that the implementation process doesn't take too long. It's just getting yourself familiar with the voice commands. In fact, we've programmed seeCOLe in various languages, one being Hebrew, so that now that clinicians in their native tongue can access clinical data. So it's all involved in the pricing and the cost of implementation using our device. Dr. Sherry, did you want to piggyback on that, or are you good?
No, I think you covered everything quite well, Carl.
Thanks.
Okay, another question? Still time for last one, Peter.
Thank you very much for the professional presentation and very exciting product. I have a question about the augmented reality hardware. I think it's kind of industry that is kind of like, cannot find its way a little bit generally. You can see VR glasses is going this way, Google glasses are being got cancelled, and but still it has its application, obviously. How do you see it developing in, let's say, near future, 1-2 years? What's going to happen in this area, in hardware terms, I mean?
Yes, one of the interesting challenges while we were in the accelerator was that we quickly understood that this is a new concept. We are challenging the status quo. We are actually challenging clinicians to no longer depend on a computer screen and to embrace virtual screens. Analysis shows through research, we clearly aren't the only ones to use augmented reality. There are a lot of healthcare systems in Oxford University healthcare system in the UK, various healthcare systems in the United States, and also some in Asia have utilized augmented reality to perform surgeries. And so the research shows that patients are not taken back by the augmented reality devices, that they embrace them. They actually like the fact that clinicians are trying to find ways to re-engage with the patients and not turn their back when they're navigating to a workstation. I'll follow up with another to your part B of that question. Where is it going to go in years? As you see this next generation with, as you mentioned, virtual reality, augmented reality, and gaming have been widely embraced. In fact, so much that training now, anywhere from engineering all the way to healthcare, also utilizes virtual reality and augmented reality to train their staff. We find that the trend shows that with augmented reality, it's going to get more and more embraced as more of the next generation are using it for common things, such as leisure or for training and things of that sort. We at seeCOLe have already identified this years ago, and so we know that this is going to be the new trend, especially as you see, the AI pin was just launched, where the premise of having information on the go is going to be something that is going to be a common use. We can call out Google, we can call out Alexa, we can call out all these different AI tools to get the information on the go. Healthcare should be one of the also industries that should do this as well.
I can add something there for you also, Carl and Peter, and is that the CTA did a survey regarding augmented reality and virtual reality, and it showed that augmented reality is on the rise and around 80% rise from the years before in acceptance and in usage. And so I think, as Carl said it perfectly, it is going to be the future. The future is catching up, basically.
Okay, so thanks, Carl. Thanks, Cheryl, for having you in the final pitch. Thanks for the 8 months that you've been on the team as Caelestinus, and I hope to be a supporter as well as witness of your future success, and I'm looking forward to wearing a piece of your gear soon myself. So thank you guys, thanks Carla, and sending my regards and love. Bye.
Thank you. We appreciate it.
Thank you.
Right, we have 3 last pitches ahead of us. The first 2 will be happening here at IKEM, and it's my pleasure now to invite Pavel from Bronin.ai. I'm not sure if I pronounced it correctly. Is
fine.
It Bronin.ai?
Hi, and thank you for the invitation.
It's nice to have you back, and I'll provide you with this should you need it.
Thank you. And thank you for having us. I'm here to talk about our endeavor in terms of chronic kidney disease at-risk patient detections. And I'm here on behalf of Deloitte and Bronin.ai, and I will explain it a bit later. So what is chronic kidney disease? It's essentially a loss of your kidney function. It's that's it. You might hear it for the first time, but be informed that this is a very widespread disease, and it's estimated like 10 to 15% of population actually suffers from it. And as the population grows older, this will be more and more of a problem. In Czech Republic only, 10,000 patients actually need to undergo dialysis, which is the end result of your kidneys losing functions. Then you need external support to filter your blood, and then the terminal state is sadly death. Each such patient incurs cost up to 1 million Czech crowns yearly for the healthcare system. So this is just financial cost. Of course, the cost on the patient life is significant because he needs to go several times a week to do the dialysis and so on and so on. And a lot of money could actually be saved if the patient were detected early. So the estimate is that more than 100 million Czech crowns would be saved in 10-year period for every 1,000 patient early detected. Why is that? Because there is a new medication on the market that is able to actually efficiently slow down the progression. However, usually the CKD is detected too late. So you detect it when you have the problem. And it's not reversible, so it only goes down or flat if it's detected. So that's our problem. That's what we are trying to bring to the table with the use of AI, the early detection system. Who are we? We are a bunch of friends and colleagues from Deloitte and ex-Deloitte, and we are all from the AI field itself. we've been trying to push the solution through Deloitte channels and networks for the past year, but we've decided recently to actually spin off from Deloitte and branch off a separate entity to actually pursue this endeavor forward. So that's why it's like Deloitte/Bronin.ai, because we want to try to actually make it happen. Okay. And me personally, hi, I'm Pavel. I didn't introduce myself at the beginning. And at Deloitte, currently I'm leading the AI team in Central Europe. So the technical people, they are doing different things around that. What we've actually did and what we are trying to push forward is it's not a flashing solution. It's not augmented reality. In terms of technology and AI, this is really simple. So you have a predictive model which is based on historical data. You train a machine learning algorithm which is explainable. So then if you would have a patient, the algorithm would say, okay, I think this patient might be at risk for from CKD based on the BMI, based on age, based on diabetes or different diagnoses that the patient already has, and some other factors. We are not aiming to provide a new box for the healthcare providers. We want to integrate this. So this simple thing saying, hey, this patient might be at risk for this and this reasons, with existing software that the general practitioners already use, and with software that hospitals use, and so on. And we do not aim to call the shots. We only want to support the experts in order to identify and detect these patients and to set them to respective laboratory tests that will be able to prove or disapprove the actual diagnosis. And the tests are non-invasive and are really cheap. So it's just a matter of getting the patient to undergo the test. Our plan and our history. So a year back, we attended the hackathon. We created the POC of the algorithm. And then this year, we had several discussions to try and push the solution forward. We had discussions with the software providers for GPs. We were in discussions with an insurer to test the approach on their data. But in the end, we always struck out on legal compliance and legal requirements of the solution itself. Because there is this lovely thing which is called software as a medical device, which essentially kills all innovation in healthcare, or at least that's my take. So we at least build a network and recently decided to actually do the spin-off and try to establish our own company in which we will push this forward. So our plans for 2024 is actual establishment of the company, do evaluation of seeCOLe, which is like the first step necessary to actually undergo a clinical study and clinical trial, which we want to do here at IKEM and some other not so specialized places. And then when we will have this, we want to apply for the software as a medical device. And what do we need? We don't need much. So at this stage, we would really appreciate network. So talk to us. We will talk to you. We will be happy to exchange like our findings from our discussions with different entities. We would be lovely to hear some tips and tricks for you. What is your experience? We really need to get some medical expert on board because we are a bunch of technical people, and for us data is data, but we really need someone from the medical field to be onboarded in order to help us drive this forward. And then we will definitely need to figure out a way how to finance the certification of software as a medical device. And that's it. So yeah, please talk to me. I'm usually shy and introverted, so we'll appreciate if you will come to me.
So thanks, Pavel, for the great pitch.
Thank you for having us. Yeah, I guess.
In the meantime, I checked your website. It says coming soon.
Exactly. It's like with the company. The company is also coming soon.
Yes, but it's a good it's the good thing because sometimes when you have a project, and some projects don't even have a website, you secured the domain, so that's great. Now, question time. Okay, right. So we have investors interested immediately.
Of course, of course. So I have two questions. The first one is about the regulation. So which class will you need to be regulated as?
99% it will be 2A because everything touching diagnosis falls under this, even though it doesn't make any decisions.
Okay, interesting. And in terms of the clinical study you mentioned, do you have already some funding on that, or do you expect to be funded by grant, or how do you expect to solve this?
We have ways of funding the study itself. So the study itself is not costly, is the SAMD, which is the costly part in the end. So the study, we can get funds for that, I'm pretty sure. So that's not a blocker.
More questions? You can also use Slido. We still have time for 2 questions, roughly.
I'm not on Slido. Can I use the Zoom for a question? It's okay.
Okay. Any?
Hello.
Yeah.
Yeah. Pavel, nice presentation. Question about the you mentioned a couple of times you're now a spin out of your parent company. So talk to us about the relationship there. Are they allowing you to leave? Who's going to hold the IP? What is the strategy forward on that? Because it can get a little bit complicated.
Yeah, it can definitely. That's a way that's in progress right now. So we're trying to get a competitors clause exception from Deloitte, and essentially I stated the situation how it is. So we would not be able to drive it forward through Deloitte. We've tried that. So there's only so much you can do in a corporate environment. So in order to get this thing moving, we want to actually make it happen on the side. So we're trying
on the side with Deloitte holding some kind of royalty or patent or.
We will try to cut ties in terms of IP because the hackathon, we were not sent by Deloitte. It was like 3 friends going to spend a weekend here, and we try to push it forward under the umbrella of our company. But essentially, like the Deloitte has not so much to do with the overall project and application and the solution, because as I said, like this is like easy AI problem. This is not some state-of-the-art computer vision flashy thing. The most complicated thing about this is actually pushing the processes and trying to get the healthcare system out of this weird deadlock where the GPs, I think, cannot even prescribe the effective medication as of now, and there are like all these different parts that are actually locking this, and we want to break those locks in order to help people.
Clear. So you have a little bit of a negotiation, but it's to be continued.
Yes, yeah, exactly. It's in the process. That's
Thank
why,
you.
yeah.
Thank you very much.
Bronin.ai is yet to be launched.
Right. One last question. Anyone? Why Bronin? My question.
Yeah. We try to come up with there's Gen AI, right? So we try to come up with different names that could be usable. One of those which I really liked was Ronin.ai, which is like Ronin is like masterless samurai, but that was already taken, of course, even in some in the medical field. So I decided to we decided to combine the word bros and Ronin in order to do Bronin.ai. So it's kind of a stupid joke, but yeah, that's what we settled for.
Stupid joke in a clever way.
Exactly. That's our way.
So thank you, Pavel. I hope Bronin to see Bronin alive next year, and good luck in our negotiations. And we will support you even when you leave Caelestinus. So it's been great working together. And again, from hackathon to prototype, that's what we do. So thank you, Pavel, for being with us.
Thank you.
Bye, and I hope to see you at the after party.
Hopefully, yeah.
Thank you. We have 2 more to go, and it's my pleasure now to welcome Honza here on stage at IKEM. And Honza is from Future Analytics. It's very pertinent because it's about the future and it's about analytics. And I can't wait how you combine these two and perhaps will change the future. So Jan Kaspar and Future Analytics.
So let's change the future. Hi everybody, I'm Jan and I am from Future Analytics. We are a startup from and spin-off company from Czech Technical University, Faculty of Biomedical Engineering. And today I would like to show you one of our products, which is from the field of telerehabilitation, and product name is the Home Balance. With this technology, we try to help patients with problems that came from. We try to help a patient after stroke, patient with orthopedic surgeries, and other patients with need of rehabilitation of stability and upper extremities, and concerning these diagnoses you will see later in our short video of our product. So we develop a device which is certified as a medical device. It's according to MDR, it's a class 1. And to this device, in the Caelestinus incubation, we develop a cloud solution that we can somehow define, we can gather the data from the device, and we can set up therapeutic plans for the patients, and how should I explain? Imagine that we have a cooperation, we have clients that are rehabilitation centers, and you have a patient after stroke, and this patient needs the care, for example, one-to-one. So he needs a therapist and there is a patient. But with our technology, there could be 4 patients at once that can be treated by one therapist. So imagine the change of the care and change of the cost effectivity of such a process that we can provide for these caregivers. So our customers are basically rehabilitation centers, rehabilitation ambulances, clinics, or the patients themselves, because our technology could be used at the clinics or at the patient home. So this technology could open a brand new market. So let's see how our product looks like.
Home Balance Care. Home Balance Care is an interactive system for remote training and therapy, which enables safe rehabilitation from the comfort of your home or other favorite place. The principle of the tele-rehabilitation solution is the remote connection between the therapist and the patient through the latest smart technologies. The patient can exercise daily according to a predetermined individual therapeutic plan without having to wait in a hospital and according to his possibilities and abilities. The therapist evaluates the results of the exercise remotely and adjusts the difficulty of the therapeutic plan. The therapist can also conduct therapy using a remote video call. The Home Balance Care platform enables rehabilitation of upper extremities, cognitive exercises, activation exercises, monitoring of physical activity, and has other benefits resulting from therapy provided remotely. Home Balance Care is an advanced medical tool for modern electronic healthcare.
So basically, this is the patient side device, and as I said, is already certified. And what we did during this Caelestinus incubation, we upgraded this device with a cloud service or cloud solution that can handle the data coming from the device. And from this data, we create some information that helps either therapist or as an adherence, it helps back to the patient. We send some motivation and overview messages back to the patient. And for this, we use our software for GP or for specialists that we did in that way that we integrated this home balance device to this solution. So now we can provide all this data to EHR systems. Okay, this is the result of our incubation. Here you can see some slides from the real cloud software that we now use at our clients. You can see how to create a therapeutic plan, how to manage patients, and all the features that are around this rehabilitation. So we started on the Czech and Slovak market. As I said, we already have clients. We have like 5 or 6 big clients from rehabilitation centers or spa rehabilitation. And now we try to reach other countries in the EU market or global market, because our technology is based on Iris for Health, on InterSystems product. Here you can see some overview of other products on the market, but no one of this is able to provide this rehabilitation data to EHR directly. Some more advantages of our product and the business model. So the customer needs to buy device or devices. This is the price of the device in Czech Republic, and then there is a price as an annual fee for the cloud service. And imagine some particular situation, if the rehabilitation center buys like 4 devices, the price they invest, they can have a revenue back on the fees from the insurance companies in 6 months. So this is based on the situation I talked in the beginning, that one therapist could serve 4 patients at once. Sorry. Yeah. Other scenario is if the patient is rehabilitating at the home, there is a half price of the total cost than if the patient comes regularly to the ambulance. Some more details about our team. We are like 25 people, IT guys, hardware guys, and project guys. And since we are close to the university, we have a strong cooperation with students and professors. So we already have a device, we have a team, we invested our private money, and we are now solving some grant projects, and we would like to ask for some 200k euro for some future development of the system. Actually, the business is also dependent on the insurance companies if they pay the care or not. So now we are talking to 2 big insurance companies to start the piloting on. We would like to prove that our technology is really efficient, not at the clinical side, or that is also efficient on the money side. So that's it.
Okay, thank you, Hanzo, for the pitch. And now we have time for questions. So, yes. Traditional, new tradition.
Yeah, okay. Thank you. So you said you're a technical guy, so I would be interested about the biggest technical challenges you needed to solve to build this device, and kind of focus on the defensibility, because, you know, if it were hard, it would be hard for other people to do that as well. And even I would be maybe even interested in IP, if you have any patents and stuff like that around the device.
Okay, actually, Future Analytics is half part of our university people, and second half of the team is a Slovak team that they did Slovak e-health and e-prescription solution, and on this solution they are running like 5.5 million people in Slovakia. So this is a real bonus of the Future Analytics that we have such a strong IT team. So our team can handle all from the beginning, from the mobile app, from the device, from the server solution, from the Iris, from the InterSystems, for the cyber security. So because they did it on the government level. And the second question was about IP. Okay, there is some IP coming from the university, and we have, as a spin-off company, we have access to this IP based on the licensing. So we have a unique license agreement with the university.
We have a question from Slido. What does your device do? Maybe you could summarize very briefly.
You can train the stability. So by the movement of your center of body pressure, we have some specialized gaming-like scenarios that are clinically proved. And the system guides you how to move your body on the stability platform. So you train particular parts of your body on your...
I actually tried it, I think, in Kladruby.
Yeah.
If I remember correctly. And you step on a board, and then you see on the screen maybe like a ball that moves on a chessboard, and with balancing your pelvis, you need to get the ball where you need. It was very difficult for me, but I remember I tried it.
Yeah, it's one of our most important customer because it is the biggest rehabilitation center in Central Europe.
So, yeah, I know it. I remember it. That was fun. Okay, more question. We have one last question from Pavel.
Hi. Did you had a negative reaction from the patients actually when you send them home instead of like having face-to-face with the actual physiotherapist?
Actually, it depends. If it is a patient in the clinical study which is paid by our program, they are quite okay with it because the care is not still paid by insurance company. So if the patient come out of the clinical study which is not paid by our project, they are not really happy about the price. So that's why we have a cooperation with insurance companies to adopt this model and to upgrade the model of, I'm missing the words in English, úhrady.
Reimbursement.
Payment or reimbursement.
Yeah, okay, thank you.
Okay, I think we've run out of time, but thank you for your pitch, Honzo, and Future Analytics. I think this is a great way to help the future move in the right direction. So thank you. Thanks again. And we have but one, last one, Caelestinus ahead of us. It should be Jason joining us online. So Jason, do we have you?
Yes, we do.
Excellent. Nice to hear you. Nice to see you. How are you, Jason?
Excellent. It is a bright and early morning for us, and we're ready to get started.
Okay, so You are the very last one to present. We can see your screen and we can hear you, so go ahead.
All right, thank you. Well, it's a true pleasure to be in the Caelestinus incubator and present at the demo day. We've got tremendous value from this experience, and we really enjoyed being part of the community and seeing all of the incredible work that people are doing around the world. As Michael and I are here on behalf of PGxCare and Anton as well. PGxCare is the leading AI-powered pharmacogenetics platform, and we'll get more to that in a second. Just as a little overview for us before we get into the details so that you know what we're about, there's an unmet need of 2 million cases of adverse drug reactions in the US. We have a proprietary ML algorithms to solve that problem. We are a scalable B2B business model working with labs and clinics. We have currently 2 clients, including sequencing.com and Dynamic DNA, and we have additional clients in the background in the pipeline. And we have a current distinguished team from UCSF, Stanford, partner with InterSystems, and as well as a bunch of other great corporations. Currently, we're raising $750K via SAFE. That will give us about 24 months of runway. Now to the problem. As I mentioned, there are 2 million cases of adverse drug reactions in the US, and these respond and relate to 250,000 annual deaths related to ADRs. And so as we can tell, this is a huge cost and burden on the healthcare system, and this is something that we want to alleviate through our best-in-class machine learning platform. And so now more on that platform in general. I think when we talk about machine learning and really any type of software, it's the data that we use. And we currently have the largest database of pharmacogenetic biomarkers in the industry. And using our type of analysis coming from PubMed, InBase, and PharmaGKB, we analyze this information and figure out the influence of these genes in terms of how they relate to the pharmacodynamics and pharmacokinetics of a drug to figure out what are the safest drugs for you. And best of all, what's included in our large database is the large number of drugs that we have. We have over 730 drugs within psychiatry, cardiology, gastroenterology. You see the list right there. I don't need to say it for you. And it's really an incredible feat to bring all of this data together and to analyze in the best way. And not only is it a feat to analyze it, but it's a great feat to have good accuracy with our model. We are working with Nisha Tagalala, who's the CEO of PGxCare, who is well-renowned throughout the AI industry as being a pioneer in this space. And so working with her, we were able to develop a machine learning model that had very good classification accuracy and the ability to accurately predict these relationships between drugs, genes and drugs. In terms of the IP, we've already set out an IP plan and have confirmed with our lawyers a way to patent these machine learning algorithms and a path to patent. I don't really need to go too much into that, so I feel like I'm preaching to the audience right here, but we are in partnership with Caelestinus and InterSystems, and we are very fortunate to have access to the technology to connect with other hospitals and genetic sequencing companies and to transfer information in a safe and efficient manner. In terms of our market and where we're headed, we are entering a $500 billion market in terms of the prescription medicine out there. And really there's a ton of, just in the US, patients who are taking these medications and who would potentially benefit from pharmacogenetics. Right now, we cover 730 drugs of the FDA-approved drugs. We only hope to keep on expanding that as better data comes out and become more confident in the type of data that we have to improve our report. And overall, you can see some calculations below on our total market size in the upcoming future as we scale up. when we go to competition, I think there's a stark difference, which is between lifestyle and really therapeutic and clinical benefit, and non-AI, AI-driven. We are the only AI-driven company in the pharmacogenetic space, period, full stop there. And this allows us to expand our database faster and more efficiently and ensure that we're getting better information to the patients. In addition, we have a translation that because of this AI benefit, it's kind of a flywheel effect where we get better clinical benefit over time compared to all of the other therapeutics. And we subtly can prove this based on some research that we've done on already 4,000 patients. There we go. This is just another way of seeing the current landscape that we have. As you mentioned, we are the best-in-class provider for pharmacogenetics, having 730 medications in 10 therapeutic areas, as I mentioned. And this is well in contrast to the other type of competition that we have out there. In terms of the revenue and where we're going, our current model is with genetic sequencing companies, which have around 500K genomic profiles in their database already. And so if we harness the database that already these patients are already sequenced, they already have the information, they just need access to a pharmacogenetic report to benefit from the benefits of pharmacogenetics, which is reduced adverse drug reactions. And using this type of pipeline that we say, if we get, let's say, 100 companies in our pipeline, that's 200 million ARR within the next 5 years. And so that's something that we're really looking forward to, and as we scale forward together. In terms of traction and where we're coming from, as I mentioned, we've already treated 4,000 patients in hospitals and laboratories in Europe. And Michael has extensively published in this area, 70 pharmacogenetic studies, including 2 large, big prospective cohort studies. If you'd like the information on that, we'd be happy to share that with you. And then in 2020, we really started to launch in the US market, and we conducted a bunch of customer discovery calls to figure out how does this product work within the US market, and finally developing this idea to partner with genetic sequencing companies and hospitals on the later end. And then finally in 2023, we've established 2 partnerships, Dynamic DNA and sequencing.com. We are going live with Dynamic DNA very, very soon. So that's some very exciting news. And in addition to that, we transitioned all of our algorithms from maybe more hard-coded algorithms to AI algorithms. In addition, it brings us, the team PGxCare, great joy to say that we received a $25,000 grant from InterSystems. We are very excited about this opportunity and what this means for the potential of our partnership moving forward. My name is Jason Akram. I'm the CEO and co-founder of PGxCare. I'm currently an undergraduate at Stanford University studying computational neuroscience and finance. I've consulted for several biotech companies and been an investment analyst at a couple investment firms. Really, this is an incredible opportunity that I've seen and I've handpicked by analyzing a bunch of other companies. And I realized that this has incredible market potential to not only save a lot of patients, but be very effective at doing that. Michael, would you like to go? Or?
Yeah, so, and I know probably your presenter. Yeah, and I'm Michael Estrada. I'm ex-postdoc of UCSF. I've been working at the Department of Bioengineering at Traditional Sciences. So currently, yeah, I'm CTO of our project, and I'm very glad to be a part of this.
Yeah, thanks, Michael. Thanks, Jason. Anton here. I'm a venture investor by background, have 5 IPOs and 3 M&As, and I see strong potential here to build a category-defining business in the pharmacogenetic space using the technologies which we have built with Michael. Thank you.
Perfect. And it's not just us. We have a whole fleet of data scientists and developers to help us move this position forward. And with the additional capital, we're just going to be moving faster. We're going to be expanding. And that's what we hope to see as an overall summary if you have any questions. But I think that's all for us. Thank you very much. It's been a pleasure to discuss with you guys.
Thank you, Jason, and the rest of the team for pitching online. You were the very last Caelestinus to demo, to pitch after the 2023 batch. So it's been a pleasure working with you, and now we have time for questions from the audience. I'm also checking Slido, so if you're watching online, you can post your question there. We have one question from Lukáš here. Okay, so.
Well, hi. I would like to learn more about your monetization strategy, because you mentioned you are going to be selling through genetics testing providers. So how are you going to incentivize them to sell you? And how are you going to set the marketing strategy for the tests? Are you going to try to motivate the providers themselves to sell it, or what's the strategy there?
I think that's an excellent question. I'd like to mention that we have a twofold approach. Right now, we're currently focusing on laboratories, but our end goal is to be in the hospital setting to show a true patient benefit, where the hospitals are, through value-based care, they have the best benefit. But the current target is laboratories and clinics, as you mentioned. I think what's really important to note is that both of our partners right now, Dynamic DNA and sequencing.com, they were already working with our competitors, and then we were able to convince them, because we have a personalized approach to our report. We create a thing that works with their marketing and their setup, and we make sure that we are a client-based first company. And then second, because of our machine learning algorithms, because of our database, because of the fact that we have 730 drugs in 10 indications and specialities, because of all those benefits, they see that it's a clear choice. Does that answer your question, or would you like to know more?
I think it does. Now we have one more question lined up.
Hi, this is Lucas. I had the same question. But Jason, could you share the best practice? How did you attract the world-class scientist in AI? The Indian name, if you, I don't remember by heart. Just share the best practice. Yeah, Nisha.
I'm sorry, what is the full question?
How did you get her to board to help you to build your algorithm? Just to share the best practice. Thanks.
We met at we met through a friend who we met at a conference, and she was really passionate about her project. In fact, her daughter did some work in the space before, and she's like, "Wow, this is incredible space." By looking at her daughter do it, I want to help you guys and to develop this to really to find better patient benefit within this market. I guess, Michael, you work with her more. Do you have anything to add to that?
No, I think that this is the almost full story. If you want more about the scientific part, of course, we can describe.
Yeah, in terms of the business part, it's the saying, you never know what it's going to be. You never know who it's going to be. You just go around and say, hey, we have this incredible project. We'd love your help. We'd love your advice. And you never know what you're going to come up with.
Right, thank you. Lukáš wanted to pick your brains because he's also looking for talent globally. That's also part of being Caelestini. You share your tips and tricks, how to find great people for your teams, in addition to finance to fuel your dreams. So thank you, Jason, for your pitch and Q&A. You were the very last one of the 13 Caelestini that we have had the opportunity to see and listen to the summaries of their work over the last 8 months. If you are interested in learning more about any of the teams that you have seen, please reach out directly. If you didn't get the contact details or didn't have time to scan the QR codes, drop us a line. at info@caelestinus.tech, or talk to us here directly, or just Google Caelestinus. It's very easy to get in touch. We'll be more than happy to put you in through with our 2023 Caelestini. And now it's over, guys. We have 5 last minutes where I'd like to invite Evgeny from InterSystems again, as well as Martin Zubek to join me on stage. And also a big clap for Petr at the back, who's been managing all the streaming, etc. Petr Žabka, our Caelestinus director, manager, the guy whom you have met online and offline. So Petr, please join us here on stage so that you get all the team behind Caelestinus. And guys, I'm waiting for you here desperately after 4 hours of managing everything, exhausted, and I'm waiting for your energy and fresh jokes to lighten up the audience after 4 hours of pitches. Petr, we have Petr here, so maybe Petr, can you also join me? I don't know if you have. Do we need the mics and stuff? Yeah, probably. So who's got mic? Please join me here immediately, Evgeny. So what are your impressions?
Actually, these were very exciting 4 hours. So I think it is more exciting than see any Hollywood movies. So I had a fantastic pleasure, and then I saw a lot of innovation. What I can say, obviously, yes, we are finishing demo day today, but this is obviously not the end. Certainly for you guys. So this is just the beginning, and we from Caelestinus team are just happy that we took part somehow and hopefully helpfully in your journey for innovation and making this world a better place.
Okay. What about you, Martin? What do you say after you have seen this, heard this in this condensed way?
The end is the beginning, is the end, is the beginning. So when we started this 2 years ago, I guess none of us expected, into what it will grow. And we are very happy about that. We are very happy about all the projects that made it to the today's demo day, but also for those who failed on the way, because it's also a way how to attempt that you've never done, and this is also it takes courage to do so. So to all of you out there, take the courage and come up there and come there next year, hopefully, for the new batch of Caelestinus 2024, and we will be all happy to welcome you. And let's do it. Let's do it once again, and we are really looking forward to the cooperation with the new partners, with the companies that went through. Majority of them are using already InterSystems technology, and we are trying to help them to be successful on the market, and that's why we are doing it, and that's why we're supporting Caelestinus. And I guess it's becoming a worldwide thing. We started 2 years ago with some companies that were rather local, and as we could have seen, we are really going global, and that's what we maybe even didn't expect when we started with Evgeny to support this idea. So thank you, Tomáš. Thank you for your help, and we are really grateful. Thank you, and we are looking forward to the next year.
Yeah, thanks. I just want to add that, and of course, we in InterSystems, we are really proud that InterSystems technology becomes a part of future innovation in healthcare, and because of you guys. Thank you.
And you mentioned it's now time for new teams, fresh ideas to apply to Caelestinus 2024. So you can register via our website. It's very easy. Just provide us with your name and contact details and maybe a brief summary about your idea. And we'll be selecting Caelestini for 2024 for the spring batch. And you are likely to spend most of your time and meet also Petr Žabka, whom I'd like to invite on stage to join us, who manages Caelestinus. And together with our girls, Vita and Irina, who are not here at the moment, but we say big thank you for your efforts during the year. So Petr is managing a team of in the background, and he's been through all the workshops and mastermind sessions, so he can tell you what you can expect in Caelestinus if you decide to join for 2024.
Yeah, I can. Hello, I can briefly summarize that here, but I'll be really happy to discuss the topic today at the after party. So if you're here before you think of registration for the next year, really stop by today for the after party, because it will be really amazing. You'll meet all of us, I hope. And Tomáš stole my words a bit, because I really wanted to thank Vita, especially because there were a number of startups that were in contact with her quite frequently, and she helped them a lot. So I wanted to help her, thank her for that, as she cannot stand here on the on the stage. The same thanks go to the guys in the back office, Vojta, Martin, Mates, who made that possible today, because I was a little bit shaking how that would turn out, and they saved it. So thank you guys for that. And yeah, I'll be definitely happy to meet you in the during the after party and in the next year's batch, because I'm quite sure there will be one.
So a big clap for Peter and the girls. Who make our jobs much easier. I just come here, you know, say a few words and then leave, but there is a lot of work behind everything. Now I'd like to invite you guys also, Petr mostly. He said that he wanted to talk about your applications for next year at the after party. I don't believe him. He doesn't want to talk about your applications at the after party. You know, just apply and then we'll talk later on in a structured manner. But just please come to have fun, to celebrate innovation, to celebrate your enthusiasm into healthcare, which is the most difficult, the most regulated, the most bloody, the most, I don't know, what? The most...
healthiest.
What?
Healthiest.
The healthiest area there is for activities. So health is the precondition to everything else you want to do in life. It's like, for example, electricity powers everything, including artificial intelligence. But health powers absolutely everything. If you are sick, you won't be able to do anything in your life. So that's why we focus on healthcare. It's great that technology helps write things, and we want to continue doing this next year and grow this and convince more and more people, young talent, old talent, whatever, to focus on healthcare, which is the condition of everything you want to do in life. But first, celebrate this tonight at the swim club. We're starting at 8 o'clock, and we have some free drinks and food and fun for you until late night or morning. So if you are watching online, of course, tough luck. Next time you should be here in Prague. But, you know, we are a global incubator, global project. So we try, maybe we will increase our physical presence next year, maybe to other continents. But it's been fun having you also online. I mean, you know, I can tell whatever. I've heard one guy having questions, which which looked pretty exciting, and so I hope you had a fun time. If you plan to invest and help out Caelestini, that's the reason why we do this. And if you just tuned in by accident or are thinking about joining or know somebody, please do let them know. Applications are open via our website. So thank you again. Thanks IKEM, our partners, and thank you that you have been able to sit through this over the past 4 hours now. Please join us starting at in 2 hours at the swim club for a little thank you after party. Thank you, guys.
Great. Clap for you.
Long live Caelestinus 2024.